70 of the Andean Health Organization Hipólito Unanue Agreement. In May 2025, we will celebrate 5 years of continuous co-learning since we launched our webinar series in May 2020. Today, we are pleased to present the webinar Health, Water, and Climate Change in Today's Globalization. This is a very special webinar organized jointly with the Copenhagen Institute for Future Studies based in Denmark. In 1971, with the creation of the Hipólito Unanue Agreement, the governments of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela united in solidarity and regional integration to make health a bridge to peace and work for collective well-being. Today, the Andean Health Organization Hipólito Unanue Agreement has a long-standing trajectory of unity and ongoing collaboration with the ministries of health of the 6 Andean countries to uphold the right to health. In this era of technological globalization, the COVID-19 pandemic reaffirmed the essential role of the health sector in ensuring well-being. That is why keeping health at the center of policies and fostering a collective conscience to unite for the common good remains a priority. Health is a bridge to integration and peace. Without the right to health, there is no right to life. Reflections like these, along with diverse information on our initiatives, can be found in the Noti Salud Andina's monthly newsletter, which we invite you to read. It is available on the Oras Kanu website and in the Andean Integration Knowledge Repository. We kindly invite you to share your name, organization, and country in the comments section of the Facebook Live or YouTube Live chat. You can also use these platforms to submit your questions or send them via email to webinarorascono@gmail.com. To obtain a certificate of attendance, you will find a link in the Facebook Live or YouTube live chat where you must complete a short survey and provide your email address. Please ensure that your email is correctly entered, as the certificate will be sent to you in the following weeks. This webinar will follow our usual format. We will begin with the institutional welcome, proceed with the keynote presentations, and conclude with a discussion based on participants' questions across the different platforms. We encourage you to submit your questions and comments. To officially open this important session, I now give the floor to Dr. Maria del Carmen Calle Davila, Executive Secretary of the Andean Health Organization, who will deliver the institutional welcome. Please proceed,
Muchísimas
Dr.
gracias,
Calle.
Bertita.
Thank you so much, Berta.
Bueno, el Organismo
Well,
Andino de Salud, Convenio Hipólito
the Andean
Unanue,
Health Organization
fue
Hipólito Unanue
constituido por
Agreement
decisión de los
was
ministros de salud
established
de
by
Bolivia,
decision of
Chile,
the
Colombia,
Ministers of
Ecuador, Perú
Health
y
of Bolivia,
Venezuela
Chile,
en
Colombia, Ecuador,
diciembre
Peru, and
de
Venezuela in December
1971.
1971.
Les doy la más cordial bienvenida.
I welcome you
Buenos
cordially
días,
to
buenas
this
tardes,
event. Good
buenas
morning,
noches,
good
según en
afternoon, good
donde
evening,
se encuentren.
depending on your
Y les
time zone.
cuento que la visión del ORAS-CONU es en el
Our
2030,
vision
los
for
habitantes de la
2030
región andina
is that the
gozan del
people
derecho a la
of the
salud y al
Andean
bienestar.
region will fully enjoy the
Las
right to
desigualdades
health
se
and
han
well-being,
reducido
with
y hay una
reduced
mayor
inequalities
capacidad
and an
de
enhanced
respuesta
collective
conjunta a los
capacity
desafíos
to
sanitarios,
address
socioeconómicos y ambientales
health
comunes
or
a
shared
través
health,
de la
socioeconomic, and
integración y
environmental challenges
cooperación
through regional
regional.
integration and cooperation.
Este es el webinar número 270
This
y
is
es muy
our
grato
webinar number
darles la bienvenida.
270, and I am
Al
very
hablar de
pleased to
salud,
welcome you.
agua y cambio
When
climático,
discussing health,
es
water, and climate
pertinente
change,
afirmar
it
que
is
un efecto del cambio climático es la
Crucial to
escasez
acknowledge
del
that
agua
water scarcity is
y
a
con
direct
ello
consequence of climate
todas las
change,
implicaciones que este
carrying
problema
profound
tiene para la salud y el
implications
bienestar.
for health and well being.
El número de desastres
The number of climate
relacionados con el
related
clima
disasters
y que generan escasez del agua, como
which
la
result
reducción
in
de los
water scarcity,
glaciares,
such as
los
glacier retreat,
incendios forestales,
wildfires,
las sequías y
droughts,
el aumento de días
and
de calor al
increased
año,
extreme heat days,
se ha
has
multiplicado por
multiplied
5 en los
fivefold
últimos
over the past 50
50
years,
años, causando
causing economic
aproximadamente
losses of
202
approximately
millones de dólares en
$202
pérdidas
million
económicas cada día.
per day.
Dichos fenómenos meteorológicos
These extreme
extremos
weather events
están haciendo
not
que
only
el
make
agua
water
no solo
scarce,
sea escasa, sino
but
impura y
also
contaminada.
contaminated
Como
and
se puede ver,
unsafe,
en primer lugar,
as
el cambio
it
climático
can be
afecta el
observed.
acceso a las
Climate
personas al
change
agua y al
directly impacts
saneamiento.
access to clean water and
Después de los
sanitation,
desastres, suelen aparecer los
and
brotes de
following such
enfermedades
disasters,
infecciosas. Lo
outbreaks
dice
of
ONU en
infectious
su
diseases often
informe del agua
emerge,
del
as
2024.
established by
En
the
relación
UN
con
Water
lo anterior,
Report of
la evidencia
2024.
es abrumadora.
The evidence
Desde
is
el año
overwhelming.
2000, los
Since the
desastres
year
relacionados
2000,
con
the
las
number of
inundaciones han
flood-related
aumentado en un
disasters has increased by
134% y el
134%,
número y la duración de las
while the
sequías
frequency
también ha
and duration of
aumentado en un
droughts
29%.
has risen by
OMM
29%,
2021. En la
WMO
actualidad,
2021.
uno,
At present,
una de cada cuatro
one
personas,
in four
2.000
people
millones de personas, en
worldwide, 2
todo
billion
el
people,
mundo carece de agua
lack
potable
access
gestionada de
to
forma
safely
segura.
managed drinking
Asimismo,
water.
en dos
Also,
de cada
in
tres
2 out of
las
3
mujeres son las
households,
principales
women
responsables
bear the
de la
primary
recolección de
responsibility
agua
for
y
water
esto agrava
collection,
desigualdades
further
de género.
exacerbating gender
Informe
inequalities.
OMS-UNICEF 2023.
WHO
En
UNICEF
cuanto a
Report
la
2023.
afectación a las condiciones de salud para la niñez,
The impact on children's health is
462
particularly
millones de niñas
alarming.
y niños asisten a
462
escuelas
million
que
children
no
attend
tienen
schools without
instalación
hand
para
washing
lavarse las manos.
facilities.
1.4 millones de
1.4
muertes
million
podrían
deaths
evitarse cada
per
año
year
con
could
solo
be
el lavado de
prevented
manos y
through
saneamiento
safe hand washing
sostenible seguro.
and
Y en
sanitation.
términos generales, cada año
In
los
general terms,
problemas
each
relacionados
year,
con el agua, el saneamiento y la
problems
higiene
related to water
segura
sanitation
son
and
responsables de
hygiene
alrededor de
cause approximately
395 mil muertes de niñas y
395,000
niños
deaths
menores
among
de 5
children
años.
under the age
Informe
of
Agua
5.
OMS
UN
2021.
Water,
En lo
WHO
relativo a la
2024.
contribución para la resolución de estos problemas,
With regard to
en
the
el
solution of
ORASCONO
these
desarrollamos
problems, at
acciones con los
ORASCONO, we
delegados de los
collaborate
ministerios
with
de salud
health ministry
de los 6
delegates
países
from the
andinos
6
y
Andean
organizaciones
countries
socias
and
para
our
lograr los
partner
objetivos
organizations to advance
propuestos.
solutions
Por ejemplo, en el
through
Plan
initiatives
Andino de
such as
Salud y
the
Cambio
Andean Plan
Climático
on Health and Climate Change
2020-2025,
2020
además,
2025.
estamos impulsando los enfoques
Additionally,
Una
we are
Salud
actively
y
promoting
Salud
the One Health and
socioambiental
social
para la
environmental
defensa de
health
los derechos
approaches to
humanos y de la
uphold
naturaleza.
human rights and
Hoy,
environmental protection.
componentes de lujo, a quien agradecemos su
With a
participación,
distinguished panel of experts,
analizaremos
we
la
will
relevancia de la
explore the
investigación y las
significance of
acciones
research
a nivel
and
individual,
action at
familiar,
individual,
comunitario,
family, community,
institucional,
institutional,
gubernamental y
governmental,
regional.
and regional
En
levels.
definitiva, la salud
Ultimately,
y la vida
health and
empiezan
life
por el
begin with
acceso al
access to
agua
safe and sufficient
en
water.
cantidad y calidad. Y si no avanzamos en la gobernanza del
Without
riesgo del cambio
effective
climático,
climate risk
la primera
governance, the
afectada por la
first
falta de agua
victim of water
salubre
scricity
será la salud
will
de las
be
personas.
human health.
Bienvenidos Martín
Welcome,
Cruz
Martin
y
Cruz,
Benigno Eric Sanz.
Benigno Eric
Bienvenida
Sanz,
Yasna
and
Palmero y por
Yasna
supuesto bienvenida
Palmero, and
Boya
of course,
Eliansen. Bienvenidos,
welcome Boja Alliansen.
bienvenidas todos y
Welcome
todas a este webinar
everyone
número
to this
270 del Organismo
webinar,
Andino de Salud
number
cuando digo
270 of our organization, ORSCONO. Thank you so much, dear Dr. Mari Carmen. Following the remarks of our Executive Secretary, allow me to introduce myself. My name is Berta Luz Pineda Restrepo, Coordinator for Climate Change and Inequalities at the Andean Health Organization. It is my pleasure to moderate today's webinar. Now we warmly welcome Professor Dr. Boji Listen, Executive Director of the Foundation Health Movement. Thank you so much, and congratulations for this webinar. I would like to thank everybody for their collaboration with these webinars. I would also like to highlight the work among countries, because these matters cannot be solved by an only country, and we very much value the collaboration with ORSCONO. Today, I would like to mention that I have been working in several plans with several entities to achieve a better world in 2040 and 2050. Of course, climate events have a significant impact. We need to mitigate these impacts. And thanks to Martin, we have significant expertise in the Copenhagen Institute, because he is very experienced in water issues, and he's present today. And I'd like to thank you for including this topic in the agenda. We must remember that even though the world is going crazy, we cannot stop doing what we need to do, and we need to work even harder together to adopt the decisions and design the plans that will save us and our future generations. Thank you very much, and congratulations for this webinar, number 270. Thank you very much, Dr. Boji. Next, we would like to introduce Dr. Martin Cruz, who leads research on environment and resources and foresight and future studies at the Copenhagen Institute for Future Studies, based in Denmark. He has worked extensively in sustainability and was selected as an expert to contribute recommendations on green growth for the G20 summit. His work focuses on the interconnections between food, energy, climate, and water, while also covering topics such as construction, housing, and security. The companies he has collaborated with include Unilever, Maersk, Noble, IKEA, Lund University, the Copenhagen Business School, the European Commission Expert Group, the Danish Energy Agency, among many other entities. He is an expert in climate change, energy, the food nexus, raw materials, geopolitics, sustainability, green consumption, and investment strategy, as well as future studies methodology. We're very happy to have you here, Dr. Cruz. Please go ahead with your presentation.
Thank you very much. I hope I'm pleased to be part of this interesting debate. It's of course an extremely important topic, and one which needs more focus in the world today, um, much more than it has already, or than it is getting. And I hope that this can contribute to a certain extent to this to the advancement of this area. I'll shortly touch upon the interlinkage between climate, water, and health, and talk a little bit about the traditional interlinkage, but also about some of the aspects that people maybe don't think about, but which has a huge impact on this interconnection between climate, water, and health. So I think one of the immediate things that come to mind when we talk about the impact of climate on health is, of course, the direct physical injury that people sustain. So getting a car in the face, you have to go to the hospital. So that's of course what we're seeing when we see extreme weather events, as we've seen just recently in Spain, where this picture is from. We also, of course, see it when we see heat strokes, as we've seen in many parts of the world, especially impacting older citizens, where this is becoming an increasing problem. In some parts of the world, like in the Middle East, this is becoming such a big problem that towards 2100, it will be difficult to actually move around outside because temperatures will be too high to actually be ordered to get rid of the heat when you're outside. We also have, of course, the impact that storms has in terms of the direct impact on diseases like cholera, dysentery, diarrhea, the fact that you have sewage water that is mixed with drinking water and create these different kinds of diseases. But I think this is maybe some of the issues that we normally talk about. I think I also want to avert the attention towards the impact it has on well, the impact flood water has on power source shortage, which is more indirect. And the fact that we have a tendency to disregard these cascading risks that we see when we talk about climate change. So this is a picture from Memorial Hospital in the United States under Katrina. And what is fairly obvious when we look at this picture is, of course, that you have an infrastructure issue, the fact that you cannot actually get to the hospital because the roads are damaged. But what is not shown on the picture here is the fact that the generators actually are in the basement. And they're also flooded. So even if you get to the hospital, you can't get any treatment because it's difficult to get treatment because there's no electricity. Now, one would imagine that this has happened, quite a long time ago in Katrina, so everyone has prepared for a different or a flood and made sure that generators are not placed in the basement. But just last year, we actually saw the same thing in Denmark. So I think many countries are not prepared for these issues, and we're not thinking about how risk is shifting. So one of the issues, of course, also is that this is a mobility risk. You need to come to the hospital, and there's an infrastructure risk. But the risk is also shifting in terms of e-health, because when people are at home and they're depending on electricity power for different kinds of e-health services to actually operate, that also becomes a huge risk. So there are different kinds of risks that we need to take into account. I almost can't talk about these issues without actually touching upon the wildfires that we just saw in California. And of course, this also has an effect on air quality, where in the US, here in LA, we saw a vastly exceeding, we saw particles vastly exceeding the safe limits in just a month ago. Maybe following on this is the other issues that we see with air pollution. If we think about cities in general, what we are seeing is that we have climate change, but at the same time we have a a city that is polluted with exhaust from cars, and you have an asphalt which is being heated by the sun, and you have air conditioning which is cooling inside, but pushes all this heat out into the urban environment. So basically, what you're getting is an urban hotbox, which is increasing the issues with respiratory diseases and like asthma and so forth. So we need to think about how we adopt to climate change, how we change the city in order to be more resilient.
La configuración. Ahí está.
Another area in question, another area that we need to think about is how climate change actually is affecting food security. And this is probably one of the biggest area. And I want to touch a little bit upon the associated risks related to this. Because the direct risk is quite obvious. The fact that we have big populations increases in China and India. We have 18% of the populations in both countries of world population, but we have relatively low level of arable land, relatively low percentage arable land. And that means these countries are exposed if there's food insecurity issues, if there's a situation where you have drought, or otherwise we see an issue with food. This is something which is of an issue, and because of these issues, we're actually seeing an associated risk, which is the fact that China and India, they share the same water resources. So in India, and actually for the Southeast Asia, Thailand included, which is the biggest exporter of rice in the world, the water comes from the Tibetan Plateau, and the Tibetan Plateau is Chinese, but the Chinese need that water in the future to make sure that they have enough production of food. So the risk here is that they will avert this water into China rather than make that water available for Southeast Asia. So, of course, if we see these issues, this will vastly impact a lot of people around the world. And this will lead to food insecurity, leads to malnutrition, leads to hunger-related diseases, and can impact also global security. We also have the problem of Africa rising. Will Africa rise, given issues we have with water? This is not, and climate change, this is not certain, given those issues that we're facing. And as you can see from this slide, especially the African continent is very impacted by climate change. So what we are seeing is also a potential weaponization of water resources. which we need to consider in. So it's not just the direct impact on health, but it's also the indirect impacts. And just to touch upon this a little bit further, I want to show you the going back to the Arab Spring. If you look at the food price increases here, which is on the slide, the red arrows or the red lines show you the riots in different parts of the world. So when you have food price increases, you also have riots. So you had riots in South America, you had it in actually most of the places around the world, you had a lot of different types of riots. This was not related to SOMI, which was one of the tags that was given to the riots. This was definitely related to food price increases. In some areas, like in Tunisia, it was a 300% increase. So when you see these kind of riots, what you see is also an impact on health, which is more indirect. In Bahrain, you had doctors that were arrested when they were treating protesters. In Syria, that was affected by this. But the Syria or the civil war, you had half of Syrian hospitals that were not functioning. You have supply chain disruptions, which is limiting access to basic medicine. So while this is not something you typically find in reports, these associated effects are quite large and can have impact in many years to come. 1 in 5 children live in conflict areas, and this is, of course, an issue that needs to be handled. But I think one of the issues that we don't talk about is the fact that even those children that are living in these conflict areas, in those conflict areas, the risk of a child under 5 years of age dying is 20 times higher for of dying from unsafe water and sanitation. So we tend to talk about the fact that there's wars in the world, and of course this is deeply problematic. But even in those areas, the greatest problem is actually the lack of water and sanitation. Now, we touch upon water. There is a lot of there's a lack of safely managed drinking water around the world. Some 2 billion people lack safe managed drinking water, and this basically means that it's contaminated with feces, and this causes millions of deaths around the world today. So to top this off, we also have some 3.5 people that lack safely managed sanitation. Now, I just want to touch upon some of the projects that we did, some of the interviews that we've done with people across different kinds of organizations. So here we were talking to the World Bank and to other institutions like the World Economic Forum and others. And I had taken a couple of interviews from various organizations. So one here is that one person here says that the price of water globally is too low, and it's very politicized. What is meant by this is really that in many areas of the world, you can't. It's very difficult to fund water. It's very difficult to get private capital to fund water simply because the return on investment, the direct return on investment is too low. And what you also see is that sometimes price of water goes down because that is a way for a democratically elected government to buy the votes of the people. So when that happens, the problem is that it becomes even more difficult for investors to come in and contribute to this area. And there was a huge optimism just around COVID that this would actually have a huge benefit for the work that would be done and the money that would flow to wash to make sure that we have access to safe water. It seems as if that optimism was not warranted, that we have not seen that flow of money, not enough at least, to make the 2030 goals. What is especially distressing, you could say, is that most of the developed world do actually not pay the true economic cost of water. But for many poor countries, what you see is that the price of water is, it's not that people cannot pay for it. They can. In some areas, they can pay up to 500 times the actual price of water because they buy bottled water. So this is a way that polarization in societies is kept in check, or is kept at in the same level, in the sense that we can really invest a lot in increasing polarization and creating better health, but the poor are actually paying the highest cost for this. So in Latin America, it's between 1.5 to 2.8 times the amount of water that you could actually pay if you were more wealthy. One of the issues here is that we see a fight between urban areas, agriculture, and industry. And industry and urban areas is pulling water. They are demanding. They put huge demands on water. And what we can do is actually we make sure that this is done more, where we increase productivity, that we make sure that water is efficiently managed. So in many areas, you see that the withdrawal of water is above 70%, and that goes to water-intensive industries. But roughly 25 to 40% of these waters could actually be reallocated and used a lot more efficiently. So there's a huge potential here. If you think about it, investing in water will get you some 7 times the investment, return on investment. If you invest in basic sanitation, the return on investment is 5 times of that. So one can ask, well, how come we can't get private capital? And this is one of the issues that is faced in water. That this is definitely something which is government financed to a large extent. When this has been privatized, as we've seen in Bolivia, we saw it in South Africa, generally it has not worked out very well. So there are still issues. Issues is also that in South America we have pollution of water resources, of aquifers. So some 40 to 60% of aquifers are threatened from pollution, mainly from runoff water from agriculture. So this creates an issue. But in general, when we talk about water scarcity, we talk about climate change, we need to understand that this is oftentimes not so much of a physical issue, but mostly an economic issue. We can make sure that water is treated if we've got the money. Surely, I just want to touch upon one of the issues that we also face here, which is a little bit away from the way we normally discuss water, I think. But we are seeing a change in the geopolitical landscape. So in the West, we've seen austerity in the US and many governments. We've seen a US for a long time, but especially with Trump, which is removing itself from the global sphere. And this creates a question, you could say, because the United States has, since the Washington Consensus, has been an advocate for free trade, floating exchange rates, free markets, for macroeconomic stability. All of this has been enforced by and supported by the IMF and the World Bank. But what we're seeing now is the growth of a new superpower, China. And while the US, through the IMF and through the World Bank, has been the guarantee, you could say, or the supporter of human rights and the pusher for democracy, which includes, by the way, access to water as a global public good, a basic human right. The question now remains, how will the Chinese contribute to global public services, such as the right to water? What we see and what we have seen in the last couple of years is that China has made huge investment into, especially into Africa, but also into South America. And this is partly a land grabbing exercise. It's partly an exercise where one tries to get a hold of resources. And as the latest debate about Greenland shows, this is also something that the US is doing now. So it's going to be interesting to see how this battle is going to turn out. This will be a battle for resources, and definitely water will be a key issue here as well. So I think I did this fairly quickly, so I think I will stop for now.
Querido doctor Martin ha hecho una magnífica presentación,
Dr.
una
Martin,
conexión
thank
muy
you for your
interesante
wonderful presentation.
entre
You've
la
made a very
salud,
interesting
el
connection
agua y el
between health,
clima,
water, and
una
climate.
reflexión sobre las grandes
You made a reflection
consecuencias, los
about
grandes
the
impactos
major
que tiene el
consequences and
cambio
impacts
climático
of
en el agua
climate
y
change
también en la
on
salud
water and
de las
also on
personas.
health.
Nos reiteró que no
You also
solamente se
mentioned
afecta la
that
salud,
not
también
only
los
health is
recursos
affected,
naturales se
but
están usando
also
y pueden
natural
usarse como
resources
armas.
are
Existe
being
deficiencia en la
weaponized.
gestión del agua
There
potable en
is
el
a
mundo.
deficient
Muchas
management of drinking
personas
water around
tienen
the
que
world.
pagar
Many
demasiado por
people have to
este
pay
recurso que
too
además
much for
es un
this
derecho
resource,
humano.
which is a
Le
human
pedimos por
right.
favor
We
mantenerse en
ask
sala.
you
Han
please to
llegado muchos
remain in the
comentarios,
room. There are
felicitaciones
many
y
comments,
preguntas.
congratulations, and
Luego
questions.
de las presentaciones,
After
vamos
the
por favor a dar
presentations,
respuestas
we
a la
will
pregunta
try
de los
to
participantes.
answer to these questions.
A continuación, con mucha alegría
Next,
y cariño, le damos la
we would
palabra
like
al
to
doctor
give the floor
Benigno
to
Eri
Dr.
Sanz
Benigno
Sanz. Él
Eric
es docente
Sanz.
de gestión del
He
medio
is
ambiente
a
en la
professor of
Universidad
environmental
Católica San
management
Pablo de
at
Arequipa.
Universidad
Es
Católica San Pablo
catedrático
in
en las
Arequipa.
universidades San
He also
Agustín y
teaches at
Católica San Pablo en
San
pre y
Agustin
posgrado.
University
Es
and
magíster en
Universidad Católica
planificación
San
y
Pablo at both
gestión
undergraduate and
ambiental,
graduate levels. He
egresado del
holds a
doctorado
master's
en
degree in
ciencias y
environmental planning and
tecnologías
management and has
ambientales,
completed doctoral coursework in
especialista en
environmental science
desarrollo de
and technology.
sistemas de gestión
His
ambiental, inventario de
expertise
pasivos
includes development of
ambientales,
environmental management
evaluaciones
systems,
ambientales
environmental liability
estratégicas y de
inventories,
conservación de la
strategic
biodiversidad.
environmental
También
assessments,
tiene experiencia en un
biodiversity
gran trabajo en
conservation
instrumentos
strategies.
de gestión
He has
ambiental.
also
Tiene una amplia
experience in
experiencia en el
environmental
manejo
management
de
instruments.
recursos
He
hídricos
has
y en
extensive
cuencas,
experience in water
gestor de
resource
modalidades de
management in
conservación con
basins and
enfoque
has led
de
conservation
conservación
initiatives
productiva,
with a
desarrollo de
productive
estrategias
conservation
regionales y
approach.
planes de acción
His
de
work includes
diversidad
regional
biológica y cambio
biodiversity
climático,
strategies, climate action
valoración de
plans,
servicios
ecosystem service,
ecosistémicos y análisis de
valuation and
sostenibilidad, de
sustainability
capacidades
analysis
de
of
carga de
natural
ambientes naturales y
and
urbanos.
urban
Es gerente
environments. He previously served as Regional Environmental Authority Manager and Deputy Manager for Natural Resources of the Regional Government of Arequipa. He currently works as a consultant and advisor in environmental planning and management in the private sector. We would like to give you the floor. Please
Muchísimas gracias.
proceed, Dr. Benigno
Bueno, asumo que sí me están
Eric
escuchando
Sanz.
bien. Voy a
I
compartir
assume that you
mi
are
pantalla
listening to me. I will share my
y
screen
listo.
and we're ready.
Lo que vamos a hablar ahora es un poco de la
My
experiencia en
presentation will
investigación y
touch
gestión
on
que
my
realizamos en Perú
experience
y cómo podemos
on
conectar esas experiencias
research
con el mundo, porque
and how can we
estamos como
connect these
universidad, nos
experiences in
conectamos
Peru with the
mucho.
world.
Ahora
As a
trabajamos con
university,
Alemania, trabajamos con
we
Brasil,
work
trabajamos con
with
Colombia en
Brazil,
investigaciones conjuntas.
Germany,
Entonces,
Colombia in
esto que
joint
les voy a mostrar
research
es un
work.
poco de lo que
So
hemos venido haciendo como
what I'm
universidad y mi
going to show
experiencia
you is what
profesional.
we have been doing as a
Lo primero, a
university.
mí me
First
causó
of all,
mucha alegría escuchar
I was
este objetivo,
very
leerlo,
happy
reflexionar sobre la
to
relación recíproca entre
read on
el
this
medio
objective,
ambiente, la salud y
reflecting
el
on the
cambio
reciprocal
climático. Esto a mí me
relationship between the
pareció muy
environment,
bueno.
health, and
Y
climate change.
yo pegué
This
lo
was
que
very
ustedes habían
positive,
puesto,
and I included
porque después
this
lo voy a
in my
mencionar en mayor detalle.
presentation
El
because
Día
I
Mundial de los
will
Pastos
touch on
Marinos, Día
this
Mundial de la
in
Vida
more
Silvestre, Día
detail,
Mundial del
the
Agua, Día
different
Mundial del Clima,
world
Atención al Cambio
days
Climático,
of
y
marine
solo lo celebramos
pastures,
en marzo.
wildlife.
Entonces, esto
These
para
are
mí
days that
es
we are
demasiado
going to
importante
celebrate
porque es
in
parte de la
March. This is
interacción que debemos
important because
entender
it is
que
part of the
tiene que haber
interaction
en
or
salud,
engagement that needs
en
to
medio ambiente
exist
y
in health,
en cambio
environment,
climático.
and
Y
climate
tiene que
change
estar
matters.
asociado
And this needs to
básicamente
be
al
basically
principal
associated
recurso que tenemos,
to the
que es agua.
main
Vamos a poner
resource that we
una
have,
definición
that
bastante
is water.
típica, sencilla
We will
de
share
lo que
a
es salud.
basic
Y en
definition
este
of
detalle lo
health,
único que
and
necesito que nos
the
fijemos es que
only thing that
la
I need you
salud
to do is
no
to focus on
necesariamente es la
this.
ausencia
Health
de la enfermedad.
is not
Y en esta
necessarily the lack
interacción
of
habla
disease, and
de
in this
bienestar.
interaction,
Cuando hablamos de
we talk
bienestar, estamos
about
hablando ya de derechos
well-being. When
fundamentales
we
de
say
personas,
well-being, we are referring to
y
basic
hablamos
rights
del
of people.
goce de un buen
And
ambiente. Y acá voy a
we talk
plantearles dos
about
aspectos
the
importantes.
enjoyment of
El
a good
goce de un buen
environment,
ambiente
the
porque esto me
enjoyment
da un
of a good
servicio
environment
ecosistémico.
because it
Eso
gives
quiere
me
decir que si buen
an
funcionamiento me entrega algo. En el
ecosystem
Perú eso lo
service.
manejamos
In
desde una
Peru,
ley, la ley
this is managed
30215, que se llama
by
Ley de
law
Retribución de los Mecanismos de Servicios Ecosistémicos. Si yo lo mantengo funcionando bien,
3215.
queda regulación hídrica, polinización, infiltración del
I
suelo,
need to regulate
formación de
this
suelos,
because
entre otras cosas.
otherwise I would have different problems.
Servicios ecosistémicos hemos
There
registrado
are
para Perú.
13 ecosystemic
Entonces,
services for Peru.
si yo lo mantengo bien, me va a dar
So
un
if
servicio.
I
Pero
provide
si
a
no
good
necesito
maintenance,
ese
I will
servicio,
receive a
ese
service.
ecosistema
But if
lo
I
puedo
don't need
tratar
that service,
según mis
can
beneficios.
I
Entonces, allí
handle
hay que
this
entender que tienen que
ecosystem
estar
according to my
amarrados
needs?
los
So
servicios ecosistémicos.
we should understand that
Un
this
poco la
well-being
idea de
linked to
conservación
services
por el derecho a la vida.
disturbs the idea
Entonces, ahí
of conservation in the
hay que tener
case
mucho
of
cuidado con
the
esto.
right
Entonces,
to
yo
life.
gozo de
We
buena
need to be
salud porque
careful with
mantiene
that.
funcionando el ecosistema,
I
pero no
am
solamente porque me da un
healthy if the
servicio,
ecosystem
sino
is
porque soy
working, but not
parte
only
de ese
because it
ecosistema y
offers
hay que
me a
entenderlo
service, but
allí.
because I'm
En una
part
clasificación
of
rápida
this system.
tenemos
We need to
5 tipos
understand
de
it from that
salud:
point of view. We
física,
have
emocional,
five
laboral, mental y
types of
social.
health:
Pero hay una nueva
physical,
salud que
emotional,
está cobrando
labor,
mucho auge y
mental,
también
and
está
social.
evidenciando
And
lo de la
there is
naturaleza nuestra
another
basura, que es la
kind
salud
of
ambiental.
health, which is
Eso
the
todavía no está
environmental
metido dentro
health.
de exactamente
It
dentro de
has
programas
not been
específicos,
included
son
in
programas
specific
transversales para poder trabajar
programs.
esta salud ambiental.
We need cross-cutting
Entonces,
programs to work on
este goce
environmental
de
health.
bienestar físico,
So
mental y emocional
this
está ligado
enjoyment, this
al
physical,
medio
emotional,
ambiente.
and mental enjoyment
Para
is
mi
linked to
país,
the environment.
el Perú en cifras, así, para la salud en cifras, por
If we talk about
ejemplo, para el
Peru,
2025, el
for
Ministerio
instance,
de
for
Salud de mi
2025, the
país
Ministry of Health
ha
of my country
destinado
has
14.478
destined
millones de soles. Estamos hablando alrededor de
14
unos
billion, over 14 billion
5.000
soles.
millones
We're
de
talking
dólares solo para un
about
año. Pero
$5 billion
eso es
only for
bastante
a
dinero
year.
realmente.
This is a lot of
Pero
money for
esto
sure.
más o menos nos tendría
But
que
this
entregar una buena
would
salud. Y en cuanto a médicos, por ejemplo,
or should
tenemos
ensure good health.
353
We have
personas para un médico. La Organización Mundial de la Salud dice
353
que tenemos
people
que tener
for one
35
doctor.
médicos por cada
The
10.000
WHO
habitantes.
says that we
Y en el Perú
should have
entonces nos faltan 58.000 médicos
We need
esa brecha la tendríamos que terminar de
58,000
cerrar en
doctors in
23
Peru,
años.
and we would need to close this gap in
Eso está
23
un
years.
poquito complejo.
This is quite
Entonces,
complex.
estoy gastando casi 5 mil
So I
millones de
am
dólares
spending
para manejar la
almost
salud de un
$5
país en
billion
un año
to
y tengo
manage
una
the health
brecha
of a
tan
country in
sencilla
one
como
year,
esta.
and I have
De todos los
a very
datos que he podido
simple gap.
extraer, me he quedado con dos.
Based on all the information I
Por
obtained,
ejemplo,
I
la
would
que
like to
más fue
focus
una que
on a couple.
reportó
For
problemas
instance,
de
the
salud
male
crónico.
population
Y ahí vamos a
reported
ver que
chronic health
los hombres
issues, and we
son
will
los que han
see
reportado
that
menos problemas de
men
salud crónica que
reported
las mujeres.
less
El
chronic health
38% de
issues
los
than
hombres en
women.
Perú tienen problemas
38%
crónicos.
of
Y en
men in
cuanto a
Peru
mujeres,
have
el
a chronic problem.
48%.
And in the case of women,
Esta
it's
brecha también deja mucho por
48%.
pensar y
This
vamos a entender por
gap
qué las mujeres reportan
poses different
mayor problemas en
questions
salud crónica.
and
Ahora, esta salud
leads us to asking ourselves
mantenida
why
así de
women are
manera
reporting
permanente
more health
puede estar
problems.
ocasionada por
This
el medio ambiente,
health
puede
could
esto ser una
be
expresión
the
ambiental,
result of
respirar
the
el
environmental
aire
impact.
sucio de las
Breathing
ciudades
the
puede
dirty
ocasionarte
or
un mal
contaminated
crónico,
air of
pues
cities could
ese
cause you
dato, por
a
ejemplo,
chronic
no lo
disease.
manejamos de esa manera.
That
De hecho,
information is
los
not
médicos
managed in
en mi
that way.
país
In fact,
no hablan de los problemas a la
in
salud
Peru,
ocasionados por el
we
medio
do
ambiente.
not talk about health
En el
issues caused
2007
by the
encontramos
environment. In
problemas
2007,
cardíacos en pacientes
we
que
found
recibían
heart
tratamiento
problems in
por
patients
el
that were
problema cardíaco
receiving
cuando la realidad
problems
es
that
que
were
tenían
receiving
un
treatments because
parásito,
of these
el
problems when
Trypanosoma
actually
cruzi,
they
que
had
lo
a parasite
ocasionaba mal de
that
Chagas y estaba en
was
megavísimo.
causing
Pero los
the
médicos lo reconocían como un
Chagas
problema
disease.
cardíaco y no
But
pensaban en
doctors
esa
were treating this as a
epidemiología.
heart problem and were not
Eso en mi
thinking
ciudad,
about
en
this
Arequipa. Entonces, ¿qué
epidemiological
estamos
issue
manejando
that
la
happened in
salud
Arequipa, in my
ambiental
city?
y los problemas ambientales
Are we
desde el enfoque de
managing
salud?
environmental health
Eso
from
viene
a
siendo
health
un gran problema.
approach?
Si quieren
That is a
o si quieren
major
completar los
problem.
datos que les he mostrado
If you
aquí,
want
pueden usar
to
esos links que
check
los va a llevar
these figures,
directamente a
you
este tema
can
de salud.
click on these
Ahora,
links
es importante
at the
entender
bottom of this slide.
que
It is
la
important
tecnología ya
to
tiene que comenzar
consider
a
that
darnos facilidades.
technology needs
Acá
to
hemos tomado algunas referencias
facilitate things for
tecnológicas
us.
y hemos
We have
comenzado, por
taken certain
ejemplo, a
technological
utilizar
references and
machine
we have
learning
started to
para
use
el
machine
aprendizaje
learning
automático
for
en la rama de la inteligencia
automatic
artificial,
learning in
que
the
logra
case of
avances en
artificial
los análisis
intelligence
para poder
with
predecir
much
cómo es el
progress
estado de
in
parte
analysis to
de varias tareas. Entonces,
predict the state of the art of
estamos
certain
intentando
tasks.
dinamizar las
We're
atenciones
trying to
en hospitales
make
utilizando
the
tecnología.
services at
Otra que
hospitals more
también
dynamic
nos ha gustado
using
mucho y vamos
technology.
a intentar
Something that we also
incorporarla porque en este universidad
found
es una
very
carrera nueva,
interesting,
es
and
una
we will
carrera de
try to
medicina,
include
que es la
this
inteligencia
in
artificial en el
the curricular
reconocimiento y la
plan.
predicción de salud.
It
Entonces
would
vamos un
be
poco
the
a
artificial
ver cómo
intelligence
se
in medical
desempeñan los
education and
profesionales
health
utilizando inteligencia
forecasts.
artificial. Y eso
The
tiene que
use
ayudar a
of
su
artificial
capacitación.
intelligence
Entonces,
in the work of
ese
professionals,
conjunto de pruebas
this
que comenzamos a ver
should help
desde la
in
salud
their training
y la
process.
inteligencia artificial
And
nos van a dar
the use of these technologies
muchas
will
oportunidades de optimizar procesos.
give
En el
us
departamento en
the
el que
chance to
hago
optimize
investigación es en el
processes
departamento de las ingenierías de la
in
industria y del ambiente. Entonces, por
the
ambos lados estamos
department where I
intentando hacer
work,
estos procesos. En la
and we're
salud, en la era
trying to
digital,
use these
también
processes, and also health in
intenta
the
transformar y
digital era.
organizar esta área en 5
We are
dimensiones.
trying to
Bases de datos
transform this
digitales,
area in
webs
five
y espacios de
dimensions:
información y
digital
conocimiento, comunicación en líneas
databases,
digitales, las herramientas y
webs,
máquinas digitales
communications in
y
digital
algunas
health, the
herramientas que
use of
conforman la salud
tools and other
médica
tools
digital.
that are
Las
part of
teleconsultas, que es
digital
algo que
medical
se
health.
realiza
The
en este país y
teleconsults
en
or
otros
remote
igual,
consults,
están
which take place in
comenzando
Peru as
a
well as in other
recoger
countries,
parámetros no óptimos
are
dentro
finding
de las
non-optimal parameters
consultas a los médicos. Entonces estamos
in
pensando en que
consultations
podemos
with
aplicar
doctors.
tecnología y con
So
un
we think
mínimo
that we can
de
apply
interacción podemos con
technology
inteligencia
with
artificial, reconocimiento
the
facial
least
o
engagement
preguntas clave,
possible
podemos
with
ayudar al
key
médico que pueda
questions
tener una
and facial
mejor decisión
recognition. We could help
en el auscultamiento,
the
digamos, a
physician
larga distancia
to
porque es teleconsulta. Entonces es importante
generate
que
better
comencemos
diagnosis
a
and
pensar en que
treatment
la
because it's
salud,
a
el
remote
ambiente y la
consultation.
tecnología ya
So
tienen que comenzar a
we need to
interaccionar
start thinking
para
about the
poder entregarnos
interaction
buenos
between
resultados.
health, environment, and technology
Esta parte
to
es importante para
have
mí.
good
Yo les estoy
outcomes.
presentando cómo
This is
mi
an
país
important part
regula los
for me.
objetivos de
I am
desarrollo
showing you
sostenible
how
a través de
Peru
una
regulates
plataforma,
the
la
sustainable
Dirección de
development
Trabajo.
goals. We do
Y
this through a
si estamos
platform.
hablando de salud y bienestar,
If we're talking
yo
about
les dejo la pregunta
health
para
and
que después puedan
well-being,
responder
I
a
would
quien nos
like
está
to
siguiendo
pose the
estas presentaciones.
question
Es
so that
cuál es
you can answer this
cómo
later
podemos
on.
ligar salud y
How can we
bienestar
link
con fin de la pobreza, con
health,
agua y saneamiento,
well-being
con
with
producción y
the end of
consumo sostenible,
poverty,
con la
or
acción
with
por el
a
clima,
sustainable
con vida,
consumption,
ecosistemas
climate
terrestres, con
action,
industria e
life
innovación
with land
sostenible. Estos son los
ecosystems,
resultados, por ejemplo,
sustainable industries.
que tiene
Those
mi
are
país.
the
No son muy
results
alentadores.
obtained
El
in my
2030 tenemos
country.
que reportar
They
esto
are
y
not very
hasta hoy
good.
día que he
This
tomado
needs to be reported
el
in
screen,
2030.
tenemos
And
127 de
according
las
to the
248
screenshot,
metas que nos hemos propuesto cumplir
we have
desde
only
2022. No nos va bien con
127
esto.
goals that have been met out of the
Entonces,
total.
la
We're
pregunta
not
es,
doing a good
¿cómo
job.
podemos ligar
So the
esto,
question is,
pero
how can
desde el
we
punto de
link
vista de
this
gestión,
from the
desde el punto de vista
management perspective,
gubernamental, desde el punto
from
de
the
vista civil, desde el punto de vista
civil
educacional? ¿Cómo
government
ligamos a la salud con el medio ambiente y
educational
con todas nuestras
perspective, how we
actividades
link
antrópicas?
health with the
Esto es un
environment,
estatus de cómo nos puede ayudar
and
a
this
entender un poco que la salud
shows us
está
how
ligada
we
al medio
can
ambiente.
understand that
Ahora bien,
health is linked to the
si
environment.
hablamos de
If
agua,
we talk about
esto
water,
para mí es muy importante
for me,
porque en la
this
ciudad
is
en la que yo
quite
vivo
important because in the
es
city
una
where
zona árida.
I live, we have a
De hecho,
dry
solo tiene lluvias
area.
estacionales,
We
que son entre
only have
enero y marzo, y
rainfall
ahí se cargan
between
nuestras
January
represas,
and
que nos
March,
entregan el agua todo el año.
which
Este año hemos tenido
enters our
muchas lluvias,
dams.
de tal manera
For the rest of the
que
year, we
ya
had
la
heavy
capacidad de
rainfall
almacenarla la ha
during
sobrepasado y
this
los
year,
daños en la
and
infraestructura
the
hidráulica para cargar esta agua
possibility
mayor y
of
menor,
storing
los daños en la
this
infraestructura
water
de la
has been
ciudad y en
exceeded,
los lugares
and there
alejados
have been
nos han
infrastructure
sobrepasado.
damages in the city
Entonces
and the
ahora
cities in the city,
tenemos que
and
invertir
these have
mucho por
been
este exceso de agua.
overwhelming. We
Entonces
need
esos
to
cambios
spend more
extremos en el
because
agua
of
pues nos están
this
dejando algunas
excess volume of
dificultades.
water.
Más
So
adelante
these
vamos a ver que
extreme
ese
changes
efecto
in water are
ya les voy a
resulting
decir si es
in
calentamiento
certain
global o cambio
difficulties. I
climático, los vamos a precisar
will
más adelante. Si
tell you
entendemos el
whether
agua
this
como una
is the
definición,
result of
pues
climate
tiene varias,
change.
desde la
If we
perspectiva
understand
química, desde
as
los términos
water,
físicos,
how do we
desde el
understand
ámbito
water from
ambiental,
a chemical
desde el ámbito
perspective,
antrópico.
in
Y para
physical
mí el más
terms,
importante ahora es el ámbito
with regard to the
antrópico,
environment? And
porque
for me,
tenemos
the
que
most
pensar en que tenemos
important
que
area
juntar
would
la
be the
biodiversidad,
anthropic
la economía
context,
y
because
la
we need
sociedad
to
con el uso
associate
del agua.
biodiversity,
Y esto nos
economics,
lleva a
and
este
society with the use
otro
of water.
elemento,
And this leads
el
us to
agua
this
como
other
commodity.
element,
Lo que
water
nunca
as
debimos
commodity.
permitir está sucediendo, pero no es
What we should
porque
have
alguien
never
quiera decir,
let happen is
nosotros queremos
happening.
el aseguramiento para tener alimentos, por la seguridad
We need
alimentaria. En el
water
2020, en octubre
to
del
have
2020, en la
a
Bolsa
food supply. In
Mercantil
October
de Chicago,
2020, the
ya se
Chicago
habló del agua como un producto
Exchange
y se
mentioned water as
vendieron
a
1.100
product,
millones de dólares
and
en contratos
$1.1
futuros, se llaman así,
billion
vinculados con el
dollars
precio del
were
agua para California. Por
sold
eso es una suma
in
muy fuerte.
futures contracts
Después, en el
with regard to
2021,
the
ya el
water
agua comenzó
prices
a
of
cotizar
California. Then
en
in
Wall Street.
2021,
Y esta cotización
water was
también le
listed
entregó
in the Wall
una
Street
oportunidad para que podamos resolver
exchange,
problemas, pero nos
and
deja en
this
un
is a chance
lado
to
muy
solve
vulnerable. ¿Qué
problems,
pasa
but
si comienzo a manejar muy
makes us
fácilmente el
vulnerable.
agua
What
y
happens
no
if I
termino
start
dándole la oportunidad a los
trading
que no
water as
pueden
a
manejarlo?
commodity
Esa es mi
and
mala.
I take
Esto
away the
es que
chance
agua como
from
commodity se maneja
others to
como
manage
usos
these
de
demands?
contratos futuros? ¿Qué
Water
significa?
as commodity
No te
is
voy a pagar
traded
en este momento, sino
under
te voy a pagar una parte
future
y
contracts.
si
It
es
means
que
that
esa
I'm not going to
parte
pay you right
necesito
now. I'm
pagarla
going
o
to
que me
pay you
incremento, yo
a
te hago ese
portion, and
después
if
del
there
incremento para que
is
no pierdas.
an
Y
increase,
con esto
I
estoy
will
asegurando
return
mis
the increase
recursos.
so that you do not
Esos
lose. And
contratos
in that
futuros
way, I am
son una
ensuring
nueva
my
forma
resource.
de
This future
mercantilizar el agua.
contract is a
Tenemos
way to
opositores y detractores y allí es que
use
debemos
water as a
entender
commodity.
que nuestro manejo
We
responsable
need
del
to
agua
understand that
no
the
puede
responsible
terminar en un
management
manejo
of water
bursátil,
cannot
porque
lead to
realmente es escasa y
a
en todas partes.
trading management because
Entonces
it is a
hay que
scarce
ponernos en el
resource
panorama al agua como un
everywhere.
commodity, como un producto.
So water
En mi
is
país
being used as a commodity.
hacemos la
In
gestión
my
social
country,
del agua. Lo que les estoy
we
mostrando acá
do what we call
es la
social
creación
management
de
of
un
water.
fondo para el agua.
I am showing you
Lo vamos a
here
crear con la
the
universidad
creation
y una
of a
empresa
water fund. It will
minera
be
que está
created
intentando
with my
asegurarse de ser
university
prohibida,
and
pero
a
también
mining
necesita los
company that
grandes
is trying
beneficios
to
de la
ensure
población.
its
Este es
water
el esquema
resource,
temático y la visión
but also
compartida
needs to
de
share the
cómo se
benefits with
podrían
the population.
integrar
This is the
la
shared
gestión
vision
a un
of
fondo.
how we could
Y
integrate
si vemos
this
el objetivo
management to a
número
fund.
8,
If
pues
we
ahí está la
look
creación de un
at
fondo del agua.
the
Todo lo demás es un
SDG
componente
number
social que tiene resultados clave
8, or
como
the eighth objective,
investigación,
we see
desarrollo
the
e
creation of
innovación,
fund. We also
puestos
have
de trabajo en
research and
personas,
development,
importante reconocer a los stakeholders, hojas de
also
ruta
work among
articuladas, hemos entendido que a
stakeholders,
veces es en el
articulated
Estado muy difícil
roadmaps.
la articulación entre
Sometimes
ellos,
we
no
see
existen los
that it is
mecanismos claros,
difficult to
control de
articulate the
política
different
pública,
areas.
es
There
importante
are
también
no
para
clear
nosotros,
mechanisms,
diagnóstico de
the control of
oportunidades,
public
o sea,
policies, diagnosis,
mirar
and
en el territorio
opportunities.
cómo es nuestro consumo per cápita
Try
de
to
agua,
see what
pero
is the per
también no
capita
solamente por el
consumption of water
consumo
in the
per cápita de
territory,
agua,
but
estaremos
also
reutilizando el agua
looking
que la
at how
desechamos
this
por falta de
consumption
tratamiento.
would be like if we
Entonces,
use
ahí es muy
wastewater that
importante esta
is not being
condición.
treated.
De
So
hecho,
this condition
les
is
estoy
very
presentando
important.
dos imágenes
In
de un
fact, I am
diagnóstico de
showing you
aspectos
two
clave en la cuenca
images
Chilcachil, en
of
la cuenca que abastece el agua
two
a nuestra ciudad.
the
En esta
diagnosis of
demanda
two
hay un pequeño
analyses
éxito,
in
digamos que tenemos
the
proyección de aridez y cambio
Quilca
climático
Chile
afecta a las actividades
Basin in
económicas.
Arequipa and how
Es un
climate
estudio que hemos
change
hecho
is
el año pasado acá
affecting
en la universidad con un
economic
conjunto de
activities.
investigadores
This
y
study
tenemos
was carried
de
out
todo lo que
last
hemos
year,
presentado. Me quedo con
and
dos cosas. Primero,
there are two important
el
outcomes
agua
here.
que usamos acá en la
The
ciudad
water that we use here in the city
literalmente viene de otro lado. O sea,
literally
mi
comes from
ciudad que
somewhere
tiene
else. My
1.400.000
city
habitantes,
that
más o
has
menos, solo recibe agua
1,400,000
de mi propia
inhabitants
ciudad del
only
39% de la
receives
cantidad
water
que sirve
from
para
the
satisfacer nuestras necesidades. Y el
39% that is used
60%
to
viene de otra
satisfy
cuenca.
our needs, and
Esto quiere decir
the
que
remaining
venimos de otro
60%
lugar,
comes
pero
from
la
another
expansión
basin.
urbana de mi
So
ciudad
what does this
afecta a la
mean?
cuenca,
The urban
perdón, afecta a la
expansion of
ciudad
my
de
city
la cuenca de donde traigo agua. Entonces,
is
ya hemos
affecting the
generado
basin.
algunos conflictos en esto,
So
porque los
we
agricultores de donde yo
have
traigo el agua para
new
abastecer a mi
conflicts
ciudad
because
están
the
demandando
farmers
mayor
of the
cantidad de
areas where
agua
I
para
extract
extender su área
water to
agrícola,
my city
porque
are
la tienen.
demanding more
Pero
water
mi
to
ciudad ya
expand
entiende que yo
their
necesito el agua, pero solo
farming
una
land.
semana.
But my city
La Ley
says
General de
that
Recursos
we need
Hídricos
water
en el
because
Perú
we
es
have a
bastante
right
clara.
to
El
water.
agua
We have
que
a law
ustedes
in
dan
Peru
no
which
pueden
is
después
clear.
quitártela por expansión económica, por
When
expansión
you
agraria o
receive
para
water,
esclavitud
you
alimentar.
cannot be
Tienes que
deprived
mantenerla.
of it
Eso crea
for
conflictos
reasons such
entre
as
los
economic
territorios.
expansion, and this
Pero lo
causes
más
conflicts
importante en
between
este
territories.
estudio ha
But the most
sido
important thing in this study
cómo
is
está funcionando la dinámica
how
de el
the
ciclo hidrológico del agua en mi
dynamics of
lugar.
the water
Sabemos que hemos aprendido el
cycle
ciclo
is
hidrológico del
working
agua como que se
in
evapora, como
Arequipa.
que
We have
llueve y
heard
se
that
almacena en un
water
río, en un
evaporates,
glaciar,
or
se
water
almacena en
is
agua
stored in
subterránea o
a
regresa al mar.
river
Pues
or
esa es la
underground
parte
water
más
and goes
imprecisa que
back to
podemos
the sea.
entender de este ciclo
That
hidrológico.
is not
En
very
este
precise.
estudio
In
hemos
this
utilizado un
study,
modelamiento
we have
para ver cómo
used
funciona el agua, pues
a
tenemos puntos
modeling
claves importantes.
designed
Como
to
es una
see how
zona de
water works.
desierto,
We have
anualmente, esto
important
está
points here
calculado hasta el
because it is a
2030
desert
y tiene 30
area.
años
This
de
has been
datos de agua.
calculated up to
Anualmente
2030. It has 30
hay
years of
una
water data.
precipitación de
On a yearly basis,
186 milímetros de precipitación
we
anual. O sea,
have an
eso cae.
annual
Recordemos que
rainfall
un milímetro
of
es un litro de agua por metro cuadrado.
186
Entonces, en mi ciudad en Arequipa
milliliters.
llueve 186
So
milímetros por metro cuadrado.
millimeters. And
O
in
sea,
my city, it's
186 litros por metro cuadrado.
186
Pero se evapora
millimeters by square
251.
meter, but the
O sea, ya tengo un
evaporation
problema
is
complejo ahí. Se está
251.
evaporando
I
más
have a complex
agua
situation here,
de la que está llegando.
greater
Y tengo una
evaporation
evaporación
than
potencial
what is coming in.
de
And
1.399
I have a
milímetros
potential
por metro cuadrado.
evaporation
Eso
of
también es demasiado complejo
more than
porque ahí tenemos que sumar infraestructura, uso de
1,000
agua,
liters
percolamiento, transporte.
per
Entonces, miren el agua
square
que
meter.
recibo y miren el agua
So
que
look at
se
the water
evapora.
I am
Ahora,
receiving
dentro
and the
de
water
esto,
that is being
cuando
evaporated.
vemos la gráfica,
When we look at
tenemos
this graph,
literalmente aquí un número de curva promedio
we
de
have an average curve of
77.63. Esta curva promedio que nos dice
77.63.
entre el número es más alto, tenemos
the
eh, baja infiltración.
this shows that
Cuando el
we
número, perdón,
have
cuando el
a
número es más
low
alto,
infiltration. When the
tenemos,
number is higher,
está bien, bajas infiltraciones y alta
yes, I'm
escorrentía.
correcting myself. We have low
Yo lo tengo alta,
infiltrations,
eso quiere decir que no está
and
metiéndose mucha agua al suelo y se está yendo
it
hacia
means
las
that the
partes
water
bajas de la
is
cuenca.
not going underground,
Entonces,
it's
quiere
going to
decir
the
que
lower parts of the
lo
basin.
poco que llueve
So
no termina
the
infiltrándose al
little
suelo de manera
rainfall
adecuada
is not
por la
entering the
característica del
soil
suelo,
adequately
característica
because of
típica de un
the
desierto.
characteristic
Y
of
toda esa
the
agua se
soil,
mueve en esta
because it
zona,
is a desert, and all this
que son los
water
acuíferos medios,
moves in this area, which are the
poco profundos.
medium-sized
Entonces, estos acuíferos
aquifers.
poco profundos,
And
primero que no
these
tengo la
aquifers,
altura determinada
first
de
of all,
dónde
I
está el
don't
agua
have
almacenada. No
the
tenemos muchos
specific
estudios
height of
hidrogeológicos.
the water storage.
Y
We lack
además
studies in
de
that
eso,
connection. And
esta
in
agua
addition to
circula de
this,
manera
this
horizontal y
water
se va
circulates
justamente a
horizontally
cualquier cuerpo de agua.
and reaches
Entonces no se mantiene
any
mucho en el suelo.
water
Lo poco que entra se
body, so it doesn't
mueve
stay in the soil
de manera lateral hacia cualquier
because
cuerpo de
it
agua.
moves
Entonces no puedo mantener
laterally
mucha cobertura
to
vegetal porque no se
any
infiltra y la
water
poca que se
body.
infiltra se mueve
I
muy
don't have
rápido de manera lateral y
green
no puedo
areas
procesar a la altura en que está
because
almacenada el agua para que le sirvan a
there
las
is
plantas.
not much infiltration.
Ese
I
es
cannot
el gran
determine
problema.
the
Y el
height,
último detalle
and
es
it
que
is not useful for
solamente
the plants.
0,7
And the last detail
milímetros
is that zero point
de
0.7
agua se
millimeters
están infiltrando al
of
acuífero.
water is
O sea, puede
filtering
decir que hay
into
una
the
buena
aquifer.
cantidad
So
de
I
esta
can
agua que se
say
mueve de manera
that there
lateral,
is a good
pero
amount
esa
of
buena
water that
cantidad
is
no
moving
pasa al
laterally, but
acuífero
this
profundo, no pasa
volume
al
is
agua profunda.
not
Aquella se va a otra cuenca
going
porque
to
está en el
the
lago
deep
subterráneo,
aquifer.
pero
It
no ha
goes to
infiltrado
another
mucho.
basin, but
Entonces,
the
encima, si yo
infiltration
quiero
is
recuperar esa
not that
agua,
significant. So
se
if we want to
infiltra poco,
recover
pues tampoco
this
entra
water,
mucho a esa reserva natural. Sabemos
this
que
water
el
is
agua
not
en la reserva
entering
natural,
the
el lago
natural
subterráneo
resource.
es la reserva
We
de agua de la
know
humanidad. En
that
mi caso, en mi
water
territorio no va
is
siendo así.
the
Entonces,
humanity's
¿cómo está en sus
reserve,
territorios?
but it is not
Tenemos ese
happening
conjunto de estudios
in my
para poder
territory.
examinar
What is
cómo
going
funciona esa
on in
dinámica del
your
ciclo biológico del agua.
territories? Do we have the studies
Y si
to
entendemos
look
este
at
ciclo biológico del
the
agua,
water
vamos
cycle?
a ver claramente
If
cómo
we understand
funciona
this cycle, we will
esto en
be
la
able
dinámica
to
del
see
clima. Y ahora
how
tendríamos que
climate
pensar
works.
si el efecto
And
invernadero,
we
el
would need to
calentamiento
know if
global
the greenhouse
y
effect and
el cambio
global
climático
warming
son
and
cosas
climate change
eh,
are
iguales, una
the
depende de la
same
otra.
things, or one
No
element
sabemos si estamos en
depends
calentamiento
from the
global
other. We do
o en
not
cambio
know if it
climático.
is
Eso todavía tenemos que
global
entenderlo.
warming
Si
or climate
entendemos eso,
change.
la parte
So
izquierda de la
we
pantalla
need to
existe una
understand
atmósfera
this. On
sin
the left-hand
proceso de
side of the
calentamiento global.
screen,
Eso
we
quiere decir que no hay
have an
gases de efecto
atmosphere
invernadero
without
y la
global warming. There are
radiación entra,
no
llega al suelo
greenhouse
y se retira
gases, and radiation goes into the
de la
soil and
atmósfera
then
por
leaves
la
the
reflexión
atmosphere
de la luz. Pero
as a
cuando yo le
reflection of
sumo
light.
gases de efecto
But when
invernadero,
I add
entra la
greenhouse
radiación y cuando
effect
regresa
gases,
se encuentra con
radiation
el gas
comes
de efecto
back,
invernadero,
and then we
rebota en
have
esta
the
molécula y
greenhouse
vuelve a retornar
gas
al suelo.
effects that bounces on
Estos
this molecule
constantes
and
rebotes que hacen que
returns
esos
to
gases
the
de efecto
soil.
invernadero
What is
se
the result of this?
sobreexciten,
These
calientan los electrones
gases
y
heat
eso
up
produce
the
un cambio en
electrons,
la
and
atmósfera,
this
un cambio de
results in a
temperatura. Se
change
va
in the atmosphere,
estabilizando.
a temperature
Ese
change.
proceso de calentamiento,
This
¿qué hace?
warming
Que la
process
dinámica de la composición química de la atmósfera por el incremento de la
impacts
temperatura
the chemical
cambie.
composition of the atmosphere,
Y la
and
dinámica de los
it
vientos en
changes,
la
and the
atmósfera
dynamics of
cambia.
the
Entonces,
winds
tengo
in the
cambios
atmosphere
físicos
changes.
y
So
tengo
I
cambios
have
químicos en la
physical
atmósfera,
and chemical
todo el
changes in the
clima está
atmosphere,
cambiando.
and this
Entonces,
makes
ahora estamos calentando el
climate
planeta con
change.
estos gases
So we are
y en
warming
algún momento
the
vamos a
planet with
evidenciar
these
que el
gases,
clima
and at some
ha
point
cambiado.
we will
Este
notice
cambio
that the climate has
no
changed.
sabemos si es
We don't know
para que
whether
haga más
this
frío, para que haga más calor, para que
change
una
will
zona se
lead
convierta en
to
desértica,
lower
para que
or
otra zona se
higher
convierta
temperatures,
en una
or
zona muy
if
lluviosa.
desert areas will
Lo más
become
seguro y lo que está
humid
sucediendo ahora
areas
es que va a haber una
or
incertidumbre
rainy
completa en el
areas.
clima, mientras
What
el
we know
mundo
for
clima se va
sure is that
estabilizando.
there is uncertainty
Como
in terms of
humanos no
climate
tenemos
as
mucho
the
tiempo
climate
en el
stabilizes.
planeta,
As
como humanos,
human
como nos
beings, we have
conocemos,
not
hemos
been
alcanzado
walking
nuestro
the
máximo
earth
desarrollo con estas
during
condiciones
many
climáticas.
years. So
No
we
sabemos qué va a
have been
pasar
able
si
to
es que la
reach a
dinámica del clima
maximum
cambia al final del nuevo
development
cambio
with these
climático
weather
y el panel
conditions.
intergubernamental
We
del cambio
won't
climático en 2030
be
va a sacar
able
un pronunciamiento
to
de si
know
sí o no hay
for the
cambio.
moment if
No
there's a
muchos
change, but
territorios
we
se
will
van a
know
ver
that in
afectados
2030
y ya
and
viendo ahora, por ejemplo, los
there
primeros
will be
exiliados
complicated
climáticos
territories.
son los que ya no pueden
We
vivir en
are
pueblos o porque hace mucho
looking at the
calor,
people
se
that are
producen muchos incendios
resettling
o porque el
because they
permafrost,
are not
que es el hielo
able
profundo de
to
la atmósfera, se está
live in certain areas
derritiendo.
because of the heat or because
Si
of the
conocen a mi país, si
thermoprost
conocen al Perú,
situation.
conocen
If
al
you know
Amazonas,
Peru, you know
el
the
río
Amazon
más
region.
largo del mundo.
The
El Amazonas
Amazon
nace
River
en
is the
Arequipa,
longest river of
en
Peru,
el nevado del Mismi.
and it
Y ese nevado
originates
del Mismi
in
tributa a la
Arequipa,
cordillera del Chila. En
that
esa cordillera
is
hay un glaciar.
ancillary
Y
to
este
the
glaciar
to a
alimenta
special
el agua que es la
cordillera. There's a
naciente más
glacier
lejana del río
that
Amazonas.
feeds this water
¿Saben qué le ha pasado
source.
a esa naciente? Perdón,
Do you know what
a este
happened
glaciar.
to this
Solamente
glacier?
le queda de cobertura de,
Look at the
de
coverage.
glaciar 0,19 kilómetros de
The
los
coverage is
33,60
0.19 kilometers.
kilómetros que tenía.
Previously, it was
Eso
33.70
quiere
square
decir que
kilometers.
ya
So
en muy
this
poco
means
tiempo
that
la naciente del Amazonas,
very
en el lugar
soon
más
the
lejano, que
origin
es en mi
of the
ciudad, en
Amazon
Arequipa,
region
ya
in
no va a
the
poder
most
registrarse,
remote place,
porque
Arequipa,
este glaciar
won't
que
be
alimenta
registered because this
a esta
glacier
cuenca
that
está
feeds this
totalmente
basin
desaparecido, está derretido. Si
is
quieren más
melting
información de eso,
down. If you
jueguen
want
ahí en el link
more information, you can
para
consult
que
the
puedan
link
entrar a ese
below
inventario de
and you
glaciares
can look at the
que
glacier
se ha hecho exitoso para el
inventory
Perú en el 2018.
that was prepared
Ahora,
by
¿qué
Peru in
impactos en el
2018.
cambio climático tenemos y los recursos
What
hídricos?
are
Operaciones de patrones
the
de precipitación, hemos
impacts?
visto, ¿no?
There have
Cambia la
been
alimentación que
alterations
tiene
in
que
the
la atmósfera, cambia el
rainfall
clima completamente.
patterns.
Se reducen las
The
reservas de agua,
climate
lo
is
estamos viendo ahí
changing, the water reserves
en este
are
glaciar, uno de los
being
tantos ejemplos
reduced.
que tenemos acá.
For instance, the
Después,
example I gave
hay
you about the
mayor evaporación
glacier,
y pérdida de humedad
there
en el
is
suelo
greater
y es
evaporation and
evidente
loss of
porque la
humidity
mayor cantidad
in
de
the
calor
soil. This
evapora
is
mucho el agua
evident
y esto
because
provoca estrés
the
hídrico en
greater
las
heat
plantas. ¿Qué
evaporates
significa
water
estrés
and
hídrico?
creates
Que las
hydric or
plantas
water
no
stress on
cumplen bien el
plants.
proceso de la
What does
fotosíntesis
this
por la
mean?
elevada
Plants
temperatura
are
y
unable to
terminan
carry
muriendo.
out
Entonces, eso
photosynthesis
es
due
complejo.
to the high
Después
temperatures
tenemos
and end up
intrusión
dying.
salina en
This is
los
a
acuíferos
complex
costeros. Ya les
situation.
voy a enseñar
We
en la siguiente
have
diapositiva un ejemplo de eso.
saline
Y bueno,
intrusion
impactamos la
in the
calidad del agua,
coastal
evidentemente.
aquifers, and
Si
we,
hablamos
of
de
course, are
eso,
having an
acá,
impact
el
on
agua y la
water quality.
agricultura, no solo en mi
If we
país,
talk
en
about
todos los
water
países del
and
mundo que
agriculture,
he
not only
podido
in my country,
revisar
but
esto,
also
tienen problemas
in
serios con
other
el
countries,
desaprovechamiento y el
have
manejo del agua. Por
serious
ejemplo, acá tenemos una
problems
irrigación
due to
en una
the
de los
deficient
lugares más
use of
desérticos de Arequipa,
water. What we see here is a desert
que
area in
donde, si
Arequipa.
podemos ver en la figura,
We can see
tenemos
in
una
the
laguna en
image
la parte
that there
inferior
is
izquierda
a
de la
pond on
diapositiva, una
the
laguna
lower left-hand
artificial que
side
se ha
of the
formado
slide. It is an
por el mal
artificial
uso del agua.
pond
Ahora,
that has been
¿cómo es
formed
que
as a
podía
result of the
generar un
deficient use
bolsón
of
tan
water.
grande de agua
How
en
was
una
it
zona
possible
tan
to
desértica de alta
generate
percolación? O sea, implica el agua muy
this
rápido. Y
water
lo que
area
pasa es
in
que
this desert
muy
area?
cerca de allí, al
What happens
parecer,
here
tenemos
is
una
that very
roca
close to this area,
impermeable, que
apparently we
justamente es
have
el batolito de la
an
costa. ¿Qué
impermeable
significa eso?
rock, which is the
Cuando la
coastal
placa lunar, la
batholithic.
placa oceánica, se mete
When
en la
the
placa
ocean
continental de
plate
los continentes,
enters the
provoca
continental
un
plate,
hundimiento.
this
Y ese
results
hundimiento justamente está atrás
on
de eso. Entonces no deja que pase el agua, es
a
impermeable. Y está provocando este bolsón de agua
certain effect
aflorándose. Pero esa agua
on
es salobre
the land
porque
level.
tiene las sales
And
de los
this
productos
area
agrícolas, pesticidas,
is
fungicidas, herbicidas,
not
insecticidas,
healthy
acaricidas,
because it's
abonos foliares, abonos
contaminated,
radiculares, entre
because it
otras
comes
cosas
from
que utilizamos para
agricultural
satisfacer
areas.
nuestras necesidades alimenticias
Pesticides,
en la
for
seguridad alimentaria
instance,
por esta
things
práctica
that are
intensiva.
related
Y ahora
to
ya se han encontrado un subnegocio
farming
para esto,
practices,
porque si
and
ven en la parte
a sub
más
business has
elevada de
been
la
identified
diapositiva
for
por
this,
estos
because if
lados,
you see
estas
here
zonas se están comenzando a
in the
comercializar.
slide,
Entonces los
these
agricultores que han
is being
perdido sus
commercialized.
tierras, porque
So
ahora están
the
totalmente
farmers that have
colonizadas, porque
lost
tienen mucha
their
agua, están
areas as a
cogiendo estas
result
sales
of the
para
high levels of
comercializar.
water, they are using this
De alguna
salty
manera se
water
palía
to
la pérdida,
market
pero el deterioro del
this
ecosistema es evidente,
resource.
solamente por mal uso del
There
agua.
is a deterioration of the
Y salud y
ecosystem as a
cambio
result of the
climático,
deficient use of water.
tenemos
If
que
the case of
revisar
health
cómo
and climate
interaccionan
change, we
estos
need to
impactos.
review how
Allí
these impacts
básicamente
interact.
hemos
Basically,
identificado que aumentan
we have been able
enfermedades de
to
transmisión por vectores.
identify that there are
Dengue es un
vector
problema serio.
communicable
serio en mi
diseases.
país este
We have the
movimiento
dengue, which is a
de animal
serious
de vectores está provocando
disease
que
in
el
my
dengue,
country,
que es
and the
esa Aedes
movement of
aegypti que
vectors
solamente está en zonas de alta
is
temperatura, ahora se esté
causing
alojando en la parte de la
that
costa,
this
donde la temperatura no es
insect
tan alta y no puede
goes
mantenerse,
to
pero ya
coastal
tenemos registrados
areas where
casos de dengue
temperatures
en zonas
are
donde nunca había
lower.
habido.
We have registered
Entonces las
dengue
zonas endémicas
cases
están
in
invadiendo.
places
Y eso es
where
complicado
we had
porque
never
estamos
had a
provocando
case before.
problemas en los
The
ecosistemas.
endemic areas are
Las zonas de
moving.
calor y
We're
temperaturas
having problems
extremas
in the
son muy
ecosystems.
complejas. Mi ciudad
The
y mi país no
extreme
recibimos
temperatures
casi
are
olas de calor,
complex
pero en
issues.
invierno las temperaturas extremas son muy
In
complicadas para la parte alta, para la parte
winter,
de
extreme
la puna,
temperatures are
porque
very
ahí tenemos alojada
complicated for
población que
the
está teniendo problemas serios
highland areas
con tener
where the
temperaturas
population
bajas,
is
¿no? En lugares donde
experiencing
la
serious
infraestructura de
problems
la
with
ciudad no
low
está apta para
temperatures,
recibir personas que viven a
where the
menos
infrastructure is not
8
suitable
grados, 6
to
grados, 5
receive
grados,
people that live
donde no tienen infraestructura
below
adecuada. Las
8
casas son de
degrees
adobe porque son
Celsius.
comunidades campesinas.
They
Entonces,
live
no podemos
in
solamente
adobe
atenderlos, sino ya
houses,
tendríamos que
so
trasladarlos por estos
we
cambios
would
extremos.
need to
Seguridad alimentaria y
resettle
nutrición,
them
esto es
as a
complejo,
result
no
of these
sabemos
extreme changes. In
cómo
the
va
case
a
of
progresar
food
los alimentos
safety and
en
nutrition,
cambios de
we are
temperatura
not sure
distintos y
how this is
extremos.
going to work as a
Ya teníamos
result of the
registrados acá
extreme
en
temperature
una parte de
changes.
mi ciudad que se llama Yauca.
In my city, there's a
Tenemos
place called Yauca
crecimiento de aceitunas.
where
Estas
we grow
aceitunas han tenido
olives.
problemas de floración por
This
las
crop
temperaturas tan
has
elevadas.
had problems
Los
as a
mayores
result
productores de
of the
aceitunas del sur
high
del Perú están ahí, pero
temperatures.
ya han perdido porque la
The
temperatura elevada y no han
most
dejado
important
florear
producers are
a los
located in
olivos,
that
perdón.
area,
Entonces sí
and they
tenemos una
have lost
complicación
their
muy seria
crops as a
allí
result
por
of
este contexto de las
the
temperaturas tan complejas en su
complex
predicción, ¿no?
temperatures,
Y bueno,
temperatures
impacto a
that
la salud
cannot be
mental.
forecasted. The impact
Sí se han
on
registrado
mental
muchos
mental health.
impactos en las
There
personas, por
have
ejemplo, que han
been
sido trasladadas de
impacts
zonas
on
de
people
riesgo
that
por
have
entrada de
been
lahares
moved
o destrucción
from
de
risk areas as
ecosistemas
a
completos
result
urbanos
of the
o el
destruction
ingreso
of
abrupto del
urban
agua producto de una lluvia muy fuerte.
ecosystems
Y
as a
bueno, y la
result of
calidad de
flooding,
vida
for
y las
instance.
enfermedades respiratorias
And
científicas porque
the
tenemos se ha elevado en el Perú el número
quality of air
de
and
enfermedades
respiratory
crónicas y
diseases.
respiratorias, también
This has
hipersensibilidades,
increased in
justamente por
Peru
el aire que
as
tiene
a
mucha polución
result of
en
the
nuestra ciudad.
contaminated air in
¿Y
our
cómo
city.
podemos trabajar estas sinergias?
And how
Ya
can
desde
we
el
work on these synergies?
2015 más o menos, por
Since
ejemplo, hacemos este
2015,
conjunto de seminarios
we have
internacionales. En este
been
momento
holding
hablábamos de
these
vulnerabilidades,
international webinars.
agua y
We
cambio
were talking
climático,
about,
donde
in
un
that
poco
case,
identificamos cuáles son
vulnerability
los
of water
retos que
and
tenemos que tener
and
para
climate change,
hacer
where
una
we
adecuada
try to
gestoría.
identify
Habíamos entendido
the
que necesitamos
challenges
instrumentos
for
óptimos para
a
la gestión. No hay instrumentos
proper
óptimos para la
water
gestión.
management.
Existe el
We
planeamiento
determined that we
institucional, pero no
need
termina de aterrizar
instrument
en la
for
parte
that.
operativa. El
There
enfoque
is
en
an
el
institutional
ciudadano
planning, but
está
it
bien.
lacks in the
Todos los
operational
países tienen
approach.
enfoques en sus
Also,
ciudadanos,
the
pero los ciudadanos no son
approach
responsables de lo
on
que
the
hacen.
citizens.
Y eso
All
nos haría
countries do this,
complicados.
but
No hay
citizens
actores
are not
involucrados que
liable
lleven a
for what they
cabo
do. There are no
los cambios respectivos para poder
committed
entender cómo funciona
stakeholders
esta dinámica.
responsible for
Además de eso, buena
making
información y
the
difusión.
necessary
Tenemos un
changes.
sistema nacional de información
We
ambiental,
have a
pero
national
de plataformas
environmental
diversas, de
information
resultados no
system from
compatibles
different
y que los
platforms
ciudadanos no lo
with
usan. De
incompatible
hecho, en esta universidad
results,
estamos
and the
creando un
citizens do not
observatorio
use
ambiental.
this. At this
Estamos
university,
ahora
we
manejando
are
agua y aire. Es una
creating
disciplina que se
an
está moviendo
environmental
porque queremos que la
observatory
población sepa qué está
because we
sucediendo
want the
con el agua y con el aire y
population to
tenemos
know
que
what
enfrentar el
is
problema.
going on with the water
Conservar el
and the
agua.
air.
Eh,
Water
Todos
conservation.
están conservando el agua, pero en realidad no sabemos mucho al
We
respecto de qué
don't
hacen.
really
Ya el
know
cerrar los
what
caños, el
everybody is
ahorrar el
doing to
agua,
do
ya no es
this, to
suficiente.
accomplish
Tenemos
this.
que llevar esto a manera
Like
macro, si no, no nos vamos
closing
a
the
beneficiar al
faucets is
respecto.
not
Y
enough. We
bueno,
need
la
to have a
articulación
macro
gubernamental es
approach
muy
and, of
importante.
course,
De nivel nacional como
governmental
nivel subnacional, en todos los
articulation.
países suele
This
ser un
is very
problema. Lo
important
que se
at the national
planea
and
en los
subnational
ministerios
levels.
no
What
termina
is planned at
aterrizando
the
en las regiones
ministries is not materialized
porque
in the different regions.
no solamente es que no se hace a medida, sino
because
simplemente es que
this
no se entiende ese tipo de planeamiento
lacks
por la alta
a
rotación de
customized
personal que se dan en
approach,
los
and
gobiernos en
also
todos
there
los
is a
lugares
high turnover
de
in
por lo
terms
menos
of
en América
personnel throughout
Latina. Entonces, estas
the
inercias
different
tienen
government
que ser por
institutions
algunos tipos
across
de o
Latin
de
America.
iniciativas, pero
So
manejadas desde
these
la sociedad
synergies
civil.
needs to be
Muchísimas
managed
gracias por haberme escuchado
from the civil
y
society's
estaré atento a sus
perspective. Thank you
preguntas.
so much for listening to me,
Excelente,
and
magnífica presentación, querido doctor
I would like to answer your
Benigno.
questions.
Nos ha
Thank you, Dr.
mostrado
Benigno.
las
You have
investigaciones tan
showed us
interesantes
the
que se
very
han realizado.
interesting
Inició su conferencia
research
retomando la
work.
agenda
You
que
started
hicimos en el
your
Organismo Andino de Salud, destacando todos
presentation
los días relacionados con
by
el ambiente que
talking
celebramos
about the
en
different
marzo. El
international
Día Mundial del
days that we
Espacio
celebrate in
Marino, el
March,
Día Mundial de
the
la Vida
World Marine
Silvestre, el
Pasture
Día Mundial
Day,
del Agua,
the
cuando además
International
albergamos los
Wildlife
glaciares, y el Día Mundial
Day,
del Clima y
the
Adaptación al Cambio
World
Climático y
Water
ahora
Day,
del planeta.
and also
Esto en el sentido de la
with the
conexión
message save, let's
tan
save our
interesante que
glaciers.
hay entre clima,
There is an
agua,
interesting
los impactos
connection
en la
between
salud. Nos
climate, water,
mostró
and the
los objetivos
impact
de
on
desarrollo
health. You showed
sostenible, la
us the
relación que hay entre
SDGs and
ellos
the
para
relationship
contribuir a esta
among them to
perspectiva.
contribute to
Asimismo,
this
resaltó las
perspective. You
problemáticas
also
que hay con el
highlighted
agua,
the different
mostrándonos
problems with
evidencia de
water,
la escasez
sharing
del agua. Y por
evidence
otro
on
lado,
water
también nos
scarcity,
resaltó
and you
desafíos tan
also
importantes y
highlighted
avances al
important
mismo tiempo, el
challenges and
vínculo
progress
entre
made
la salud,
in
la era
the
digital, la
link
salud
between
ambiental,
health,
el
the
uso de la
digital
tecnología y los
age, and the
desafíos
use
tan
of technology,
importantes
and the
que
very
tenemos. Han
important
llegado muchas
challenges that we
preguntas,
are
muchas
encountering. We have
felicitaciones y
received many
comentarios. Le
questions
pedimos,
and
por favor,
comments and
mantenerse en
congratulations
sala,
as well.
que luego
We
de la
ask you to remain in the
conferencia
room
de
because
Yasna
after
daremos un
Yasna's
espacio para el
presentation,
diálogo
we
y
will
para la
have a
respuesta a las
Q&A
preguntas.
session.
Reiteramos el agradecimiento.
We
A
would like to
continuación, con
thank you
mucha alegría,
for
le
your
damos la
patience.
palabra a la doctora
We
Yasna
would now
Palmeira.
like to give the
Ella
floor
es
to Dr.
enfermera,
Yasna
egresada
Palmeira.
de la
She's a
Universidad
nurse graduated
Católica
from
en
the
Chile,
Pontifical Catholic
diplomada en
University of
bioestadística
Chile.
y políticas públicas,
Yasna holds a
magíster
diploma
en
in
salud
biostatistics
pública
and public
por la Universidad
policy.
de Chile
She has
y
earned a
doctora
master's
en
in
salud
public health
global
from the University of Chile
por
and a
University
PhD
College
in
London.
global health from
Actualmente
University
Yasna es
College
investigador
London.
en The
She's
Lancet
currently a
Latinoamérica y
researcher at
directora de
Lancet
investigación del
Latin
Centro
America and
Latinoamericano
Director
de
of Research
Excelencia en
at
Cambio
the
Climático y
Latin
Salud de la
American Center
Universidad
of Excellence
Peruana
in
Cayetano
Climate
Heredia.
Change
Su
and Health at
investigación se
Universidad
enfoca
Peruana
en la
Cayetano
relación
Heredia.
entre el cambio
Her research
climático
focuses
y
on
la
the
salud
relationship between
poblacional,
climate change
así
and
como
population
también la
health,
salud
as well
planetaria.
as
Adelante, querida Yasna,
planetary
suyo
health.
el espacio.
Please proceed,
Muchas
Dr.
gracias,
Yasna.
Berta. Muchas gracias a
Thank you
todas y
so
todos quienes están
much, Berta.
conectados y
Thank you so
muchas
much
gracias
to
por
everybody
las presentaciones de
present
Martin y
today. Thank you
Benigno,
for
por hacer esta introducción tan
Martin's and
interesante con
Benigno's
miradas
presentations
desde lo global,
for
¿cierto?,
this
a un elemento
very
muchísimo más
interesting
local en
introduction
Latinoamérica, en particular en Perú.
from the global
Voy a
landscape
intentar y
to
recordar
what
hablar
happens here in
despacio.
Peru. I
Si
will
no,
try
Berta, tú me
to
dices, por favor,
remember that
stop.
I have to
Y
speak
tengo
at
una
a
pequeña
slow
presentación
space.
un poco para
Berta, please tell me if I'm
limpiar
going too
quizás
fast. I
todos los
have a
elementos
short
que quizá ya antes
presentation
fueron
to
presentados
link
y
the
cómo
elements that
finalmente esto
were
termina
previously
afectando la
shown
salud de la
and
población
how this is
con la
affecting the
mirada de cambio
population's
climático y
health
la mirada que nosotros tenemos
from the point of view
desde
of
Lancet
climate
Countdown y hemos
change
avanzado.
and
Así
the
que
perspective
muchísimas
of
gracias
Lancet
nuevamente por
Countdown.
la
Thank
invitación
you
y el
again
espacio.
for the invitation
Solamente
and
de
the
manera muy
space.
breve voy a hablar de la
Very briefly,
generalidad,
I will talk
limpiando estos
about
elementos que ya vimos,
general
los datos
issues.
que nos entrega a nivel
We will look
internacional
at
el
the
link entre
international
cambio
data
climático, salud y
based on
también
the link between
agua
climate change,
y
health, and
obviamente todas
water,
estas relaciones y los
and of
potenciales
course,
impactos en
how
Latinoamérica.
this
Como
relates
ya
to the
se
potential impacts in
estableció
Latin America,
antes en
as
todas
it
las
has
presentaciones
already
y los
been
comentarios,
mentioned
sabemos
in
que
the
el
previous
agua es
presentations.
completamente vital
Water
para la vida.
is
No
vital for
somos
life.
nada sin
We
agua.
are
Y no
nothing
solo
without water.
vemos el agua es vital para la
And
vida desde un
not
aspecto
only do we see that
fisiológico,
water
porque
is
nuestro
vital for
organismo
life,
necesita
physiological
consumir agua,
speaking,
sino que también desde un
our
aspecto
body needs to consume water, but it is also vital for agriculture to have means of subsistence. And we know what happens when extreme weather events unfortunately affect the production of food and the impact at an economic and health level. Water is also important and vital for all the progress made with regard to hygiene and sanitation in our countries. Thanks to a safe access to water, what we have is a reduction of diseases, particularly infectious ones. Another link that was mentioned by Martin was that of energy, and we will look at this in general terms. Water plays a main role in the generation of energy and in the case of agriculture, and how this becomes a nexus that is key for human health. And this is the nexus I was mentioning to you in general terms. On the one hand, we are able to develop thanks to water. We talk about fresh water, drinking water for human consumption that we can also use for other developments. For instance, energy and food production through agriculture. So we have these three elements that work together so that individuals and communities are able to develop as adequately and healthy as possible. If we double click on this nexus between water and agriculture, what we see is this. This is what we see here is that out of 100% of freshwater consumption, and we see what share of that consumption goes or is directed to different purposes. One percentage is used for domestic purposes, another percentage goes for industrial uses, and also for agricultural purposes. If you see this slide, when you see a deep blue color, it means that out of the total consumption of water, the greatest part goes to the agricultural sector. If we focus on Latin America, from Mexico to Chile, you will see that the color here is dark blue. So the greatest proportion of fresh water that we are extracting or withdrawing goes to agriculture, and a small part goes to industrial processes and domestic or household purposes. And also here we have the human consumption water. Why is it important to have this information? Because it gives us potential challenges for access, use, quality distribution of what remains for human consumption. The 97% of the planet is water. Only 3% is fresh water, and out of this 3%, there is a very small part that is precisely water that is available for consumption, and the greatest part of this portion goes to agriculture. So what do we do with the minimum portion that remains for human consumption? This small fraction Who has access to this small fraction? Martin mentioned this. The quality of this fraction for human consumption. How can we distribute this in the right way if in some areas water isn't available because there are no lakes, rivers, or glaciers, as Benigno was mentioning? How do we take care of this water? So we have another challenge here that is not only associated to the availability of water, but to how we are using it. Nowadays, our consumption rates of this small fraction of drinking water is so high that it cannot be comparable to the recovery rate of that water from the point of view of natural processes. Therefore, we are consuming much more than what the planet can give us in terms of water, and this results in problems in the case of water scarcity for human consumption. And this graph shows that we are depleting these renewable freshwater resources. And this graphic comes from our world data, and it shows the amount or volume of resources that we have from rivers and underground water. In each country, we have Peru, Chile, Colombia, Bolivia, Ecuador. We have the general levels for Latin America, also Argentina, and you may see how these resources have been reduced from 1961 to 2021. So this reduction has been sustained and exaggerated, quite exaggerated. We are going or living through times that where we are not using this vital resource in the appropriate way. And if we see the positive side, we understand that we are using this resource excessively. We know it's vital, but how has this affected certain people? How a percentage of the population has access to water that is or can be safely consumed? And again, in the y-axis, we see the percentage of the population that has access to this water from 2000 to 2022, and we see different countries in the region: Chile, Americas, the Americas, Latin America, Colombia, the world, Ecuador, Paraguay, Peru, etc. In general, we see that this proportion has increased over time, which is positive to the population because it tells you that policies are increasingly focusing on the people's access to this drinking water in a safe way. But if we compare the situation between countries, we see differences in the percentages of the population with access to water. Even inside the same region, we're not comparing this with the world. So we have equity or equality questions with regard to access. This reflects the share of population that has access to certain infrastructure to wash their hands, particularly access to water and soap. We have Cuba with 93%, where we have basic access to water and soap. We have Belize, 90%, Ecuador, 87%. But again, we have countries in the region where the largest part of the population, for instance, in the case of Bolivia, people do not have access to this infrastructure or basic services, which jeopardizes the health of people in these countries. So we have questions in terms of equality in the case of access to this resource with an impact on the people's health, if we look at the death rate, if we look at the people that die because there is no safe access to water, sanitation, and hygiene, we see, for instance, the following dark orange color, where the death rate is higher. And we see countries in South America with higher death rates and also in Central America. And we have inequalities here. So we should see how we have been building our assistance and our decision-making processes with regard to the management of the resource and how we provide access to the population to said resource, which we know is vital for life. So all of these decisions that I am mentioning can be added to others. These human actions that generate inequalities or not are added to others. We have had a progress in the management of the resource, greater availability of water, of safe water for human consumption. However, this progress is in danger as a result of climate change, which is exacerbating the inequalities that already exist in our system. For this reason, the United Nations has established that water is in the center of this crisis, and it is being added to the other crises. I will be brief in this part of my presentation, and we see that the effects of the climate change is having an impact on temperatures. We see this in Latin America with extreme weather events, and we see in the news that these events are being more frequent and are affecting the population. So more or less, the population is aware of this problem because they are living the problem, and we also see extreme rainfall events. This is data from the IPCC. Based on scientific evidence, we are looking at regions or areas in the regions with different situations. We have areas with a higher number of extreme rainfall events, which has led to floods. And Martin shared a picture of what happened with Katrina. But we have also lived this in Rio Grande do Sul last year, where there were extreme rainfall events that led to serious floods that were responsible for many deaths. We need to see how the availability, access, and quality of water was affected because it is a cascade effect. And also, we see that this climate change in certain areas is causing droughts. So our weather is being polarized. We can see extreme rainfall events on the one hand, and on the other, we see severe droughts at the same time. And we also see this in the region. And Benigno told us what was happening in the Amazon River, which is drying up. And this, of course, has consequences for biodiversity and human health. And this data from Lancet shows us what is going on with extreme droughts in the world. And if we look at this area, we have dark brown points in South America. It means that we are having more months with extreme drought in almost all countries of the region. And how does this relate to health? And how can we evidence this in indicators that help us make better decisions? If we look at this diagram of the World Health Organization, we see that this climate change is combined and interacts with certain vulnerability factors, which includes social and economic factors, including social inequalities. And we have these extreme weather events. We have an impact on the quality and quantity of water available for human consumption. And this water also affects the potential production of food. And if this is the case, it affects the health of people. Why? Because this leads to an increase in malnutrition indicators and waterborne and foodborne diseases. This is the longer pathway, but if we have water stress, we will have a direct damage on the health of people because they lack access to safe water consumption. And there are different loops between these different elements. What happens if there are heavy rains that affect the water dams and also the volume of food that can be produced with an effect on human health? The same is true when we have droughts, where people need to store water, and if these storage areas are not safe and there is the presence of mosquitoes, we increase the risk of these mosquitoes being bred in these areas and a risk for the population. We have cascade risks that interlink climate change, health, and water. At Lancet Countdown, we analyze the different indicators. We were not able to look at the impact on health because the relationship between the elements is quite complex, and we find the problems in the case of data availability. They are not compatible 100% among countries or lack a long-term perspective to study the climate change. But what we have seen is that climate change is happening. We are living more and more extreme events in the region, and this has an impact on health. We have also seen that our adaptation policies are not being adequate enough for us to solve the problems resulting from climate change and its impact on health. Health is not being prioritized in climate change negotiations as a central element, and this makes it impossible to observe the real impact on individuals. And why is this relevant? We can say that there has always been an impact of climate on health since the old age. We always had cyclones, high temperatures, droughts from a natural perspective, and our systems have tried to adapt to this climate. The thing here is that climate change modifies all of this pattern, and the new climate is no longer the one you had 30 years ago, and our systems are not prepared for this. And this jeopardizes human health because we are not capable to respond to this new climate. And not only does this change generate a greater pressure on the health sector because we will have more heat strokes, more deaths if we have extreme weather events, for instance. But also there is an effect on water, how we distribute it, how do we take care of this resource? What can we do if there are individuals who are experiencing water stress and then have to undergo a drought? So the politicians need to realize that this is not going to happen in 30 years. It is happening now, and human health is being affected. So our messages, and that would be to close my presentation from Lancet Countdown. We need to take action now, because if we don't, and if we do not adapt to climate change, we will jeopardize all the progress made at different levels, at the social level, at the environmental level, at the health level. The progress that was so difficult to achieve in Latin America in terms of time and resources. So we need to try to start thinking about intersector policies that include energy, transportation, health, and how this interrelates to finance policies that aim to improve development and health for everyone, and how can we achieve that this financing is sustainable over time, that is not related to political cycles. This is not about asking ourselves if science has been clear. Science has been clear for many years. So it is about agreeing on certain guidelines to achieve a more prosperous development for societies in Latin America. Thank you for your attention. It was a wonderful presentation, Yasna. She mentioned that water was a vital resource for life. However, we are overexploiting it. She included very important reflections on the link between water problems and climate change, and how this increases the inequalities that are already present in our societies. A while ago, we said that in March we have very important international days related to the environment, and also the International Women's Day. And as Dr. Mari Carmen said, when faced with water scarcity, women need to walk long distances to obtain water, and these increases gender inequality since childhood, among many others. So it is very relevant to take action. Thank you, Yasna. We thank all those that joined us today from the Ministries of Health, academia, several entities and social organizations across our beloved Latin American and Andean countries, as well as European countries. Thank you so much. We have received warm greetings and congratulations and very interesting questions. We have selected some of these questions due to time constraints, and now I will read two questions for each participant. For Martin, there is a very interesting reflection. We need a radical increase in investment in water and sanitation to comply with SDG 6, ensuring the availability and sustainable management of water. So, based on that reflection, for instance, in Andean countries, there are
financieros
not
para
enough financial
implementar estos planes. ¿Qué hacer?
resources to implement these
Y la
plans.
segunda
What can
pregunta
we do
es,
about that?
¿qué
And the second
experiencia
question is,
con la gobernanza del
what
agua
is
en los
your
países nórdicos
experience with water governance in
que
Nordic
comparten
countries
una
that
buena práctica? Podemos
share
retomar
some
en la
good
región
practices?
andina.
Which of these practices
Aprovecho
could
de
we
una vez
apply
y
in
hago
the
también
Andean
las dos
region?
preguntas a
I
Benigno.
will
¿Cómo
make or pose the two
mantener
questions to
la
Benigno.
seguridad hídrica
How can
de
we
la región
maintain
andina
the water
y los
safety
usos de
in the
agua y
Andean region and
saneamiento
the
desde
use
una
of water
política
and
de salud
sanitation
ambiental
from
regional?
a regional
Y
environmental
nos
health
preguntan
policy
también
perspective?
qué
And
están
another
haciendo las
question,
empresas
what are
privadas en
private
relación
companies doing
con
with
conservar,
regard to
proteger el
preserving
recurso hídrico.
and protecting
Por otro
water?
lado, para Yasna, por
And
favor,
for Yasna,
¿existen
two
políticas
questions.
públicas
There are
ejemplares en la protección de
exemplary
recursos
public policies
naturales
for the
y la
protection of
reducción
natural
de huella de
resources and
carbono
the
con
reduction
justicia
of the
social
carbon
que
footprint with
abordan las
social
problemáticas
justice
presentadas?
to
¿Y
address the
qué
problems
impactos al corto
presented,
y
and
mediano
what are
plazo
the short and medium
tienen las
term
decisiones
impacts
de
of
políticas
the
de relaciones exteriores de Estados Unidos que
decisions
se muestran
from the
contrarias
perspective
a
of
la
foreign affairs
necesaria
in the US that are
adaptación
contrary
climática,
to the
resiliencia climática?
necessary climate
Esas son las preguntas que hemos
adaptation
sistematizado para
and
no
resilience.
extendernos y no
These
abusar de su
are the
tiempo. Por
questions
favor,
that
le
we
damos
have
la
selected
palabra a
due to
ella.
time constraints. So you have the floor, please.
I go first.
Yes.
So I think in terms of the first question, funding, I think there's an interesting link between climate change and funding for water. Now, if you look at the national determined contributions that the different countries are making to reach Paris, the Paris Agreement, um, I think 42 countries have actually put water as a part of that. So I think it's interesting to look at the interlinkage between investment in water and also how you can how you at the same time can meet the Paris Agreement. So so I think that's at least one area I think where one should look into that intersection. For the second question um, about what Northern European countries can teach, I think speaking from the North Scandinavia, what is the benefit of the northern system is a very stable political environment, meaning that even though we have shifts in government generally will abide by the agreements that have been made, and most agreements are made across the floor, so across different political parties, which means that if someone um, makes a deal, they will abide by that, and that means you have trust in the system for long-term funding. You have trust that there is a there's that there isn't too much populism that can overthrow those deals, and that creates a general a positive environment both for investment, but also for thinking about the long term and those long term investments of government investments.
Muy bien. Eh, las dos preguntas que me
Well,
hicieron están asociadas mucho, Un
The two
poco
questions
haciendo la línea
posed
rápida, si es que nosotros
are
queremos resolver el problema
related to
hídrico
the
o también
following. If we
salir del
want
cambio
to
climático
solve
del
the
país,
health and
tiene que partir desde el lado
climate
local.
change and water
Tenemos que
problem,
tener
we
planeamiento
need to
estratégico.
start
El Perú
from
tiene
the
incluso
legal
un
point of
decreto
view. We
legislativo
need
que es
to
el
have
1080, que es
a
que asocia el
strategy.
SINAPLAN,
We
que es
have
un
the
programa que planea todo en el Perú.
legislative decree
Pero ahí
1080,
viene el problema, y lo
which
mencionaba
talks about the
Yasna.
SINA
La
plan,
parte nacional
and we
no
have
se
a problem
articula con la
there.
parte regional. Entonces
As Yasna
tenemos
was
un
saying,
planeamiento nacional,
the
pero en las
national
regiones
part
no lo
is
usan.
divorced from the
Es más,
regional
desde los
part.
planes de
So
gobierno
we have a national
vendidos
planning that is not being used by
para
the
las campañas
regions.
políticas no están alineados y la
There
gente no entiende
are
esa parte.
plans that are
Entonces
being
eso ya
sold
es
during
un
the political
esfuerzo
campaigns, and people
malo,
do not
porque este
understand this.
plan, el
This is
Centro de
a
Planeamiento Nacional, lo hace
deficient
para
effort
nosotros,
because
pero no lo
this
respetamos. Entonces, si tienes un planeamiento,
national
tienes un
planning
presupuesto
is not being
asignado,
respected.
puedes
If you have
programar,
planning, you have
curar,
a budget, and
reparar
you're
todo
able
lo que está
to
asociado a la
repair or
infraestructura
cure
hídrica, por
everything
ejemplo,
that is related
en
to
las partes de la sierra
water
es mucho más
infrastructure
complejo,
in the highlands. This
porque
becomes more
ahí
complex.
hemos tenido experiencia de hacer siembra y cosecha de agua. ¿Qué
We
hemos estado
have
logrando con ello? Podemos
been
filtrar agua en el
sowing and
subsuelo
harvesting
para
water.
que aflore en alguna parte. Y ahí la
We
llegada de
have
la siguiente
been
cosecha
filtering
es el
water into the
cuidado.
soil
Bueno,
so
el cuidado
that
la
it
primera
emerges
vez
in another
hace la
area.
simple
And
cosecha de agua.
what does
Manejar
the
una
private
micro represa es
company
muy
do?
complejo. Puede costar
They
alrededor de
harvest
60.000
water. It
soles al
is
año.
expensive
Y
and
eso lo va a
complex
manejar un
to
privado. Lo
handle
hace un privado, pero se lo
a
entrega a la
water dam.
mancomunidad.
This
Pero 60.000 soles al año
is
para dar
not
mantenimiento a una
possible
compuerta,
for
porque
a
recuerden que estamos
private
haciendo una
company.
represa. Si viene una avenida de agua y se
If
rompe esa represa,
there
podemos
is
tener
a
un
problem
desastre,
with
hay que
the
mantener
dam,
eso.
we
Y eso cuesta
can
esa
create a
cantidad. No la
disaster,
podría
and
mantener.
it is very
Pero también el
expensive.
privado nos
A private
preguntaba,
company
oye, ¿y esa agua
would
que
not
yo
be
estoy
able to
infiltrando
afford
en el
this,
suelo, en
but
esta
the private
microrepresa,
company
va a
would
llegar para
say to
mí,
us,
para el agua
this water
subterránea
that
del
I am
Colsango? Y
filtering
le
to
hemos
this
dicho no.
dam
Está
will be
metiendo
available
todo
to
su
us.
esfuerzo en el fondo
And
común del
the
agua.
answer is no.
Entonces ya también tiene un
So
revés, porque
the
bueno, me gustaría que me lo
company is
resolvieran directamente.
investing
Y estamos intentando encontrar
at a
nuevas
social level,
iniciativas
and
para
they
que la
say
empresa
we
privada
would like
use
a
el agua
retribution or
de
a
manera adecuada. Pero más
benefit.
allá de
We're
eso,
trying to find ways
tenemos que
for the
entender
private
que
companies
nosotros tenemos un
to
impacto en
make a
nuestra
good
agua.
use of water. We need to
Dos
understand
cosas
that we have
claras
an
en ese
impact on
estudio
water.
que yo les
Two
digo.
clear points
¿De
here
dónde
that
viene el agua de la
I
ciudad?
share with
Y
my students.
pregúntenselo a sus pies, a las
The
personas
question
que
is,
conocen. ¿De dónde viene el agua? Ellos me dicen, desde mi
where does
represa.
water come
Ellos me dicen,
from in
desde
the
mi tanque de
cities?
agua ahí
They
en la
answer,
casa.
from my
Pero
water
nadie
tank at
dice que el
home or
agua
from the
viene del
dam,
sitio
but
hidrológico. Eso se les tiene
nobody
mostrado que es muy
says that the
complejo.
water comes
Y eso es a nivel
from
global, que
a
nos
water
conecta a los
cycle.
países de
And
América del Sur. Entonces, si yo tengo
this
una
is at a
persona que está
global
pensando que el
level that
agua viene
connects
de
us
su tanque
between
de una
Latin American
represa, es la peor
countries.
percepción para poder
If
conservar.
somebody
Y la
thinks that
segunda,
the
que
water
les
comes from a
pregunto,
dam or a
¿cuánto de
tank,
agua
that is
tienes
the worst
encima?
perception
Y entonces
to
algunos me levantan la
improve
botella y
things.
es medio litro. No,
And
no, 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 realmente.
when I
Ponen
ask
un
them
pantalón
how
de
much
mezclilla, un
water
pantalón de jean, podemos tener
do
como
you have
3.000 litros de agua. En unos zapatos de
carrying,
cuero, hasta
for
5.000
instance,
litros
they
de
show me a
agua.
bottle,
En
but
buena cuenta,
when we look
encima
at the
tenemos,
different garments that people
podríamos contar
use,
hasta diez
we
mil
could
litros de
be
agua
talking about
en la ropa que te has puesto hoy y
10,000
que la has
liters
comprado y
of
que
water
posiblemente
in the
la
clothes
vas
that
a,
you
y que
are
tengas muchas de esas y
work
va a estar
that you're
almacenada en tu
wearing
closet.
today.
Entonces, ¿cómo puede ser posible que esa
And
falsa
so how
percepción
could it be
que es
possible
solamente
that
el agua
this
que
false
tomamos
perception
nos
that
pueda
water
ayudar y
is
que al final vamos
only
a
the
preguntar
water
qué
that
hace
we
la
drink?
empresa privada? No, ¿qué hacemos nosotros?
So what is the
¿Cómo
question
logramos
here?
conservar ese recurso? Entonces,
How can we
metámonos en
preserve
la
this
obra.
resource? That is
Ya no
not a
miremos
question for the
de
private
atrás.
company. It is a
Seamos
question
los
for us.
protagonistas.
Let's be
Gracias.
the protagonists. Thank you.
Gracias, quizás voy yo. Bueno, muchas gracias por las preguntas
Well,
también.
thank
Están
you so
bien
much for
difíciles.
the questions. They are difficult to
En
answer.
relación a la pregunta uno,
With
que era
regard
políticas
to
públicas ejemplares
question
en la protección
one,
de recursos naturales
exemplary
y
public policies in the
disminución de huella
protection
de
of
carbono,
natural resources and the reduction of the carbon
la verdad es
footprint.
que estudiando en particular, por ejemplo, leyes de marco
To be
de
honest,
cambio
after
climático, viendo
studying
todo lo que
framework
son las
laws on
contribuciones
climate
nacionales
change and looking
determinadas
at
que
the
están
different
bajo el
national
Acuerdo de París y al cual
contributions
los
under
países
the
se
Paris
pueden
Agreement
enviar
that
hasta
has
5 años
been executed by several countries and which are increasingly ambitious. And after reviewing interesting constitutions, in Latin America, there are several countries, Bolivia, Chile, I think Colombia as well, and many others. At a constitutional level, the environment is protected. There is a constitutionally protected right to water, and probably now I am going to speak outside my expertise. When it is time to enforce this law, the decision-making process is different from what the Constitution says. And from a legal point of view, probably an attorney could correct me. There are gaps and vacuums that allow for that. So to highlight an exemplary public policy is difficult because it will depend on what the theory says, which is different from what happens in practice. Last year, we were looking at the national contributions from Colombia, and a fundamental pillar included the protection to biodiversity. It was a central action pillar. So it shows you that there are policies that contribute to the protection of certain natural resources, biodiversity, including water, but we need to revisit how this is happening in practice. It was regretful to watch in the BBC News, I think it was yesterday morning, what's happening in Belém in the Amazonian region, where
reunión de las partes, esta conferencia de las partes está ocurriendo en Belém este año en noviembre.
as a result of the COP30 being held in Belém, I don't know how many trees were logged, destroying the nature and a protected area in the Amazon only to build a highway so that the participants could be at the COP. Even though there can be positive aspects for the locals, we know that this has a serious and huge impact on protected areas and on biodiversity that affects the role of the Amazon region in terms of water balances. It is a complex example.
Como esto quisiéramos que sea y realmente
There
nuestras
is a
acciones.
difference between what we would expect and our actions. And with regard to the short and long-term impact of these policies, it cannot be denied that the different postures with regard to the current American administration, the case of climate change is quite complex. I'm talking about climate change.
Y ayudas a ciertos
Much
países
of the research funds and aid to other countries are being erased. And this is a threat to progress in the world's public health efforts. I do believe that the decisions being made have an impact on what's happening. It doesn't have to do with believing or not in climate change. There is an impact on sustainable development and public health. I am surprised to see that funds are being cut off for vaccine research. That is a threat to public health. It does have an impact, a huge impact, not only in terms of climate change, but also beyond. Thank you so much for your answers. We thank you for the questions made. We were not able to select them, but we will consider them as topics in future webinars. We thank you for your interest. I would like to ask each of the participants to leave us a final message. Please go ahead in the order of the presentations. Please, a final message or closing remark.
I think, just as was just mentioned, I think we're in a situation where it's becoming increasingly difficult. First of all, reaching the 2000 objective of clean water for everyone is not going to happen. Also, with the new presidency that was just mentioned, it's going to be even more difficult. So I think it's really an uphill battle going forward. I'm afraid. I hope that things will change, but I think at least for the next foreseeable future, the short-term future, I think we're in a situation where we struggle.
Bien, yo tengo por decirles que no hay manera que como humanos no
As
impactemos al
humans,
planeta. No
we are
importa
going
que
to
tengamos
have an impact on
iniciativas
the
muy
planet.
puntuales. Lo que
Even if
pasa
we
es
have
que
specific
la
initiatives,
masificación de lo que consumimos, la
what happens
industria
here is that the
lo
massification
intenta
of what we
entregar, pero con una
consume
huella muy alta. No
has
hay
a
manera
very
de que algo
high
ahora sea
footprint.
totalmente natural
There
y que impacte
is
muy poco
no
al
way of
planeta. Y
having
eso hace
something
incidencia
completely natural and with
básicamente en
zero
el clima,
impact.
que es todo lo que nos
And this has
regula,
an impact
e
on
impacta
climate
directamente en nuestra
and
salud y en nuestros
directly
recursos.
impacting
¿Cómo
our
podemos
health
decir, bueno, me
and
voy a hacer totalmente
resources?
natural como
We
antes para dejar de
cannot
impactar? Porque
say,
nuestra
I'm going to
dinámica es
be
totalmente
natural,
distinta.
100% natural,
Alimentarnos,
to stop
mantener
having
nuestras
an impact because
ciudades
of that the
están
dynamics
dejando
have
esa
changed.
huella que
Feeding
para las
ourselves,
futuras
maintaining
generaciones
our
no está
cities are
segura.
leaving a
Y
footprint
estamos
which is
haciendo
not safe
esfuerzos
for
ahora para
the future
intentar
generations. And we are
bajarle ese
making
impacto, pero no nos
efforts to
resulta.
reduce this
Lo único que
impact,
nos
but we're
queda
not
es
being successful.
adaptarnos. Y
The
adaptarnos significa
only
tener un
possible solution is
control de
to
cambio,
adapt.
deletear nuestra máquina,
It means
hacer
to delete our
una
machine,
especie de
to
backup
have
de lo
a
bueno
damage control,
y empezar a
make a
construir
backup of what
sobre lo
is
que
good, and
podemos rescatar.
start building on what
Ya
we
más
can
adelante nos
recover or
podremos
rescue.
decir, si lo
Further
hicimos o
along the
realmente
way,
fracasamos
we
en
will
el
be
intento.
able to
Entonces,
say if we were
metámonos en esa
successful
acción.
or not. So
Enteremos, se llama
let's
ciudadanía
take
ambiental.
action.
Si tengo
Let's
una
be aware.
participación
It is
responsable con mis
being
decisiones
an
ambientales,
environmentally
voy a ayudar
responsible
mucho a
citizen.
poder
If I
conservar
have
los
this kind
recursos y
of
dejar de
approach,
impactarlos
I
tan
will be
negativamente como lo estamos haciendo
able
ahora
to
para
contribute to the
satisfacer nuestras
conservation
necesidades.
of
Ejerzamos
resources
esa
as we're
ciudadanía,
doing now.
porque
We
es
are
un deber,
affecting
no es
them.
un derecho.
Let's exercise this duty. It's not a right, it's a duty.
Bueno, quizás me gustaría solamente dejar un concepto o un par de
Probably
conceptos
I'd
aquí
like
para que
to
reflexionemos.
leave
Dado
you a
el
couple of
escenario que
concepts
estamos
for
viviendo
reflections.
desde la perspectiva climática,
Given
desde la
the
perspectiva de las emisiones
climate
que llevamos,
change
desde los
and
niveles
emission
de
perspective,
negociaciones internacionales y desde lo que es
from the
política y
point of
contexto
view of
internacional, creo que
international
nos queda
negotiations and
unirnos y
international
colaborar de
policy,
manera
what
holística
we have to do is
y
to join
estratégica.
forces and
No solo
collaborate
pensando en
strategically
un
and
área,
holistically.
agua y salud, no, es que está
We
agua,
do not
salud,
need to
energía,
think
y cómo
about
podemos
water and
optimizar el
health. There
trabajo en
is also
conjunto y
energy,
estratégico para tener
and how
múltiples ganancias
we
y
can
lograr, ojalá, con
optimize
eso pavimentar un
strategic
desarrollo
work
mucho más próspero
to
de nuestras
obtain
generaciones y las que
benefits for
vienen.
all,
Así que esos dos
to
conceptos me
guarantee the
gustaría destacar.
livelihoods
Gracias,
of
doctora, y gracias,
our
equipo.
generations and future
Muchas
generations.
gracias, muy
And that would
bonitos
be all.
mensajes. Reiteramos el
Your
agradecimiento
messages have
por
been
sus
very
excelentes ponencias de
moving.
los
Thank you
doctor
so much
Martin
for
Cruz, de
your
Benigno Sanz,
presentations.
querida
Thank you,
Yasna
Dr. Martin
Palmeiro.
Cruz. Thank you,
Reiteramos
Dr.
también a
Benigno
las
Sanz. Thank
personas el
you, Jasna
agradecimiento
Palmero.
por
We would
todas las
like to
felicitaciones
thank
y
again the
participación en el evento,
participants
al equipo del
for
organismo
your
andino de salud
presence.
y
We
a
would like to
todas las
thank
personas
the
que
team at Horas
participan en
Cono
esta
and
actividad que
all
ha
the
sido
people
posible
that took
gracias al
part in this
compromiso
activity
con la
that
integración
was made
andina y
possible thanks
latinoamericana.
to the
Cedo la palabra a
Andean,
la doctora
Andean and
María del
regional
Carmen
integration.
Calle
Now I would
Dávila,
like to
secretaria
give the
ejecutiva,
floor
para el
to
cierre de
Dr.
este
Calle
webinar en
Davila,
nombre
the
del
Executive
Organismo
Secretary,
Andino de Salud,
for her
convenio y convención
closing
unánime.
remarks.
Adelante, querida doctora.
organized this
Mis
event
primeras palabras
organized
son de
by Orozcono.
agradecimiento a los
My
panelistas, a la
first
moderadora.
words are
Han
to
sido
express my gratitude
3
to the speakers and the
exposiciones
moderator.
fascinantes,
We have
pero aquí hay
witnessed
un
to
hecho, no
three
nos podemos
fascinating
convencer de los que ya
presentations.
estamos convencidos,
But
¿no?
there is something here. We cannot
Esta,
convince ourselves
este
among
enamoramiento del
those who
tema
are
comenzó
already
hace más de 6 años
convinced. We
en
started
una
looking at
reunión
this
que
topic
tuvimos en
6
Cusco
years ago at a
y donde
meeting we
estuvo
had in
Cayetano
Cusco,
también, creo que estaba Estela, no me
where
acuerdo quién estaba.
Stella was present
Pero
from
el tema
Cayetano.
es que
I don't remember who
estos
was present.
webinars sí son vistos.
The
En ese
idea,
momento
or
tenemos
what I
más
have
de
to say,
300, casi
is that these
350
webinars
personas
are
conectadas.
attended. We have more
Pero
than
eso no es lo
300
importante. Lo
people
importante es lo que
present
va a pasar
today,
mañana.
but that is
Mañana
not
entran a los webinars
important.
nuevamente. Entonces, yo
The
creo que
important thing here is what is going to happen
el primer
tomorrow.
aviso es
So
más gente
the
tiene que conocer
first
del tema, ¿no?
message is more
Porque tú
people
no
need to
defiendes lo
know
que tú
about
no
this topic,
conoces,
because you
¿no?
cannot
Y tú puedes
defend
pasar por la
what
vida
you
sin saber
ignore, and you
absolutamente nada de
can
cambio
go through
climático.
life without
Y el tema
knowing nothing
prioritario definitivamente
about
es
climate
agua.
change.
¿Por
And
qué?
the priority
Porque
here
agua
is
y
water. Why?
vacunas
Because water
son
and
las
vaccines
dos medidas
are
preventivas más
the
importantes
most
para
important
la
preventive
prevención de
measures
enfermedades.
to prevent
Primero va agua,
diseases.
segundo va
First,
vacunas.
water, then
Y como que estamos
vaccines.
siendo atacados
And
en las dos
we
líneas, ¿no?
are
Pero
being
bueno, en
under
fin.
attack
Por otro
on
lado,
both
el
fronts.
lema de este año
And
es
the motto for
salvemos
this
nuestros
year was,
glaciares.
let's
Así que
save our
quería hacer
glaciers.
solamente
So I
algunos
just
comentarios de los
wanted to make a
glaciares, ¿no?
few
Debido al
comments
cambio
on the
climático,
glaciers as a result
definitivamente
of
se
climate
están
change.
derritiendo más rápido que nunca.
They are
De acuerdo a
melting
los datos, en el
down
2023 los
more
glaciares
fast than
perdieron más de
ever.
600
According to data in
gigatoneladas de agua,
2023,
la mayor
glaciers
pérdida de
lost
masa registrada
massive
en las
amounts
últimas
of
5
water,
décadas.
the highest
Los
level in the
glaciares son
last 5
esenciales para la
decades.
vida.
Glaciers are
Su agua de
fundamental
deshielo es
for
vital
life.
para disponer de agua
The
potable para usos agrícolas,
meltwater is
industriales,
important for
producción,
agricultural,
bienestar. Y
industrial
bueno,
uses, for
este rápido
production and well-being.
derretimiento está definitivamente
And this
provocando que los flujos de agua se vuelvan
meltdown
inciertos, lo que
is
acarrea
resulting in
profundas
uncertain water
repercusiones para el
flows,
planeta
which
y sus
leads to
habitantes.
deep impacts to the
El año
planet
pasado tuve
and
la
its
suerte de estar en un
inhabitants.
curso de
Last year,
Cayetano
I was
llamado
able to attend to
Cambio
a course
Climático
organized
y
by
Salud
Cayetano
Mental.
University. It
Y
was
no puedo dejar
entitled
de
Climate Change
insistir
and Mental
mucho en
Health,
el tema de
and
salud
I
mental.
would like to
Y
insist
mi
on
primera
the
tarea
mental
fue
health
justo
topic, and
glaciares.
my
¿Qué
first
significa?
task was
Ahí Berta me
glaciers.
ayudó. ¿Qué significan
Berta
los
helped me
glaciares, no?
what
Y yo
is the
recuerdo
meaning of
que
glacier.
en esa
And
tarea
I
hablábamos
remember
que
that
desde el
in that
Instituto Nacional de
task,
Investigación en Glaciares y
we
Ecosistemas de
mentioned that
Montaña, el
in the
Inventario
relevant
Nacional de
institute,
Glaciares y
the
Lagunas de
National
Origen
Glacier
Glacial para el 2023
Inventory for 2023
mostraba que
showed
2084
that
glaciares y 8.466
2,084
lagunas a nivel
glaciers and
nacional,
over
con una
800
pérdida total de
lagoons at the national level had
1.348.75 kilómetros en
a
58
loss of over
años.
1,000
¿No? Nosotros
kilometers
tenemos el
in 58
68% de
years.
los glaciares tropicales del
We
mundo y hemos
account for
perdido el
68% of
56% de
glaciers
su
globally,
superficie.
and we have
Así que
lost over
definitivamente
50% of their
esto de los
surface.
glaciares sí tiene que ver,
And
porque puede
glaciers play
desencadenar
a part
estrés,
because
ansiedad
they
y
can
otros
lead to
problemas de
stress,
salud mental.
anxiety, and
No
other
solamente
mental
porque
health
el más
issues.
deshidratado se puede deprimir y
Not
estar ansioso,
only because a
sino
dehydrated
por el
person can
hecho
be
de
depressed
el
or be
ambiente,
anxious,
¿no? El estar
but
acostumbrado
rather
uno
because
a
of the
mirar
environment.
alrededor
If we're
suyo
used to looking
montañas, glaciares
around
y
and
no
seeing
tenerlos,
glaciers
también tiene que ver con la
and not
salud mental.
having them there,
Así que yo creo que ha sido
is
realmente un
related to
webinar
mental health.
fascinante,
I
pero
think it
vuelvo
has
a
been
decir
a
lo que dije al comienzo.
fascinating webinar, and
Entre
I would like
nosotros
to
ya estamos
repeat what I
convencidos.
said at the
Agradezco
beginning.
toda
We're
la
all convinced
información
here.
brindada por Martín,
I thank you,
por
Martin, for
Benigno,
the
por
information
Jasna.
shared.
Me parece
Also,
súper
my
interesante lo que
gratitude
están
to
haciendo en
Benigno
Arequipa,
And Yasna, I
algo
think that what is
a mí que los
happening in
trujillanos me dicen
Arequipa
que no,
is
pero por algo
really
Arequipa es la segunda ciudad
interesting.
de nuestro país,
For some
definitivamente.
reason, Arequipa is the
Sí,
second
todos los Trujillos, y me
largest
voy a
city
Trujillo este fin de semana,
in
así que no sé en qué problema voy a
Peru,
estar. La próxima
even
vamos a
when
ver.
the people from
Pero lo
Trujillo
que
say that
ocurre
they are
es
the second largest city. I'm
tenemos
going to Trujillo
que
this weekend, so I'm
adaptarnos.
going to be in
No somos
trouble.
cambios. No
We
hay
need to
otra.
adapt to
¿Ok?
changes. There is
Pero
no other
también
solution.
tenemos
But
que ser
also, we need to
íntegros.
be
Íntegros. ¿Qué significa integridad?
individuals with
Hacer las cosas que
integrity.
decimos.
What
No sé,
does
lo que
this
acaba
mean?
de compartir Yasna de Belén
Do
me
what we
hace
say.
acordar hace
What
algunos
Yasna
años
said about
cuando teníamos
Belen
las
makes me
grandes
think
cumbres mundiales sobre
of
pobreza
what
en
would
hoteles
happen
5 estrellas.
some
Que
years
justo
ago
yo
with
acabo de
the
acordarme porque
huge
en algunos
poverty
estuve yo y
summits and
realmente
high-end hotels. I
la misma
was there
sensación que
in
tenía
one
en
of
ese
those
momento,
events
¿no?
and I had the
Ahora,
same feeling.
definitivamente el agua es un derecho y
Water
el agua
is a
también
right,
tiene que ver con la
and water
interseccionalidad. ¿Qué significa
has to
eso?
do with
Aparte de tener en
intersectionality
contra que
in
soy mujer,
addition
que soy rural,
to
que soy
having against me that I am a
discapacitada, que
woman
soy
or I'm
de
disabled or
complexión
I live in a rural
indígena,
area or
también
I come from
sabemos
an
que
indigenous
la
community,
disponibilidad de agua
we
tiene
also
que ver
know
con
that
eso.
water
Así
is
que
related.
muchísimas gracias.
So
Ha
thank
sido
you
realmente
so
un
much.
webinar
It has
excepcional.
been an
No está
exceptional
Boya, ya Boya
webinar.
está en el avión.
Boja is
Gracias
no longer
Boya por
here.
haber
He is on the plane.
invitado a
Thank you,
Martín. Hemos
Boja,
tenido
for
la
inviting
posibilidad
Martin.
de escucharlo.
We had the chance
Gracias
to
Benigno
listen
por
to him.
compartir
Thank you,
todo lo que se
Benigno,
está
for
haciendo en
sharing
Arequipa
what
y
is
muchas
being
gracias
done in
Yasna
Arequipa. And
por
thank you,
todos los
Yasna,
trabajos de Lancet,
for
de
all the
Cayetano y de
good
Lancet
work
Countdown
at
Latam.
Lancet,
No quiero
Countdown
terminar
Latam,
sin
and
agradecer
Cayetano University.
profundamente
I would
Berta,
like to
Berta Luz Pineda
express my
Restrepo, es un
gratitude
motorcito
to Berta
en todo
Luz
el cambio
Pineda
climático.
Restrepo.
Agradecer
She
a
is a
todos los de
driving
Horas
force
CONU
in
que hacen
climate change.
posible
I'd
que
like to
hayamos
thank
llegado
all the team at
al
Horas
webinar
Conu
número
that have
270.
made it
Yo sé
possible
que es
to
mucho
have
trabajo, pero
webinar
muchas más son las satisfacciones que podemos
270. I know
compartir
it is
con
a
nuestra
lot of
comunidad.
work, but we
Voy a
have a
invitarlos
lot
al
of
siguiente webinar.
satisfactions
El
with this
siguiente
webinar. I'd like to
webinar
invite you
se
to the upcoming
realizará
webinar
el día 18 de marzo.
on
Será nuestro
March the
271
18th.
y el tema
It'll
será
be webinar
nuevamente la
271, and the
tuberculosis, que
topic
es la
will
principal
be
enfermedad infecciosa
tuberculosis
del
is
mundo.
the most important
Después de haber leído
infectious
nuestro
disease
informe el año
in the
pasado, nos
world.
hemos quedado
After
nuevamente
reading
sorprendidos,
our
no
report from
sorprendidos,
last year,
sabíamos
we
que iba a
were struck.
suceder.
We,
Así que nos vemos el
well, we
próximo
will not
martes,
surprise.
11
We
de la
knew this was
mañana,
going to happen.
acá en
See
Horas
you
CONU,
next Tuesday,
donde
11 a.m.
estamos
here at Horas Cono,
completamente,
where we
completamente
are
convencidos que Bolivia,
fully
Chile,
convinced that
Colombia,
Bolivia,
Ecuador, Perú
Chile,
y
Colombia,
Venezuela,
Ecuador, Peru, and
juntos somos
Venezuela
más fuertes,
together
juntos
are
logramos más
stronger.
lejos. Nos
Together
vemos pronto.
we
Gracias.
can step further.